She had stitched 17 wounds under enemy fire with nothing but field dressings and sheer nerve. Tonight, she was on her knees in a hospital parking lot, pressing her hands against an old man's bleeding leg, and the CEO of Halverton General was screaming at her to stop. She didn't stop, so he slapped her across the face in front of 40 people. 10 minutes later, a Navy helicopter shook the windows of the entire building. Nobody moved. Nobody breathed. And the old veteran lying on the gurney looked at the CEO with something colder than anger. "You have no idea," he said, "what you just did. Before we go any further, if you're watching this right now, drop a comment and tell me what city you're watching from. I want to see how far this story travels. And if it moves you, hit that like button and follow along, because what happens next inside Halverton General is something none of those people will ever forget." Now let's go back to where it started. The rain had been threatening all afternoon. It came in the way Oregon rain usually did in late October. Not dramatically, not all at once, but in a slow creep that turned the parking lot pavement dark and made the fluorescent glow of the hospital entrance look smeared and too bright at the same time. Halverton General Medical Center sat at the edge of Caldwell, a mid-sized city that prided itself on its community hospital the way small cities often did, with plaques in the lobby, donor names on the walls, and a CEO who wore his lanyard like a medal. Donna Mercer was 31 minutes into her shift when she saw the woman crouching beside the ambulance bay. She almost walked past her. Most people would have. The woman, blonde, compact, moving with the kind of economy that didn't waste motion, was already down on one knee beside an elderly man sitting against the exterior wall, his left pant leg dark and wet with something that wasn't rainwater. A wheeled walker lay tipped over beside him. He'd gone down hard, maybe caught his shin on the wheel, and the gash along his calf was deep enough that Donna could see it from 15 feet away. The woman crouching over him wasn't a doctor. Donna knew that because she knew everyone in the trauma wing, and this woman's badge, pale blue, lanyard a little crooked, read RN with the kind of newness that meant she hadn't been there long enough to collect a coffee cup from the break room. She was also doing something that Donna couldn't quite process. Her left hand was applying direct pressure with a folded piece of gauze she'd apparently pulled from somewhere, her scrub pocket maybe, and her right hand was already threading a needle with the smooth, automatic confidence of someone who had done it 1,000 times in conditions far worse than this. Not inside. Not under proper lighting. Not after prepping a sterile field. Right there, on wet pavement, in the cold, with a man who was barely conscious and mumbling something about his granddaughter's recital. "Sir." Her voice was calm in a way that wasn't performed. "I need you to stay very still for me. This is going to feel like pressure. Not pain, pressure. Okay?" The old man nodded. "What's your name?" "Walter," he managed. "Walter Briggs." "Okay, Walter, I'm Nora. You're not going anywhere. I've got you." Donna stopped walking. She stood there for a moment, watching Nora Callahan. That was the name on the badge. She could see it now. Work with a precision that didn't match her tenure. New nurses weren't supposed to have hands like that. Steady, practiced, almost surgical in their movement. She placed 3 interrupted sutures in the time it would have taken most of the ER residents to locate the suture kit. "She's been here 6 weeks, a voice said behind Donna. She turned. Priya Okafor, one of the senior nurses, had stopped beside her, arms crossed, watching with the same expression. 6 weeks? Donna said. 6 weeks. She filed 2 incident reports in the first 10 days. Both times protocols were being ignored and patients were getting delayed care. Yusuf doesn't like her. Donna knew who Yusuf was. Everyone knew who Yusuf was. Marcus Yusuf had been CEO of Halverton General for 4 years, and in that time he had restructured the billing department twice, fired 3 department heads, and installed a check-in protocol for the ambulance bay that required every incoming patient, including walk-ins who arrived on their own, to be registered in the system before any clinical contact was initiated. It was, he had explained at 3 separate all-staff meetings, a liability issue, an insurance issue, a compliance issue. It was in practical terms a process that sometimes made people wait. Nobody liked it. A few people had said so, quietly, in break rooms and parking garages. Nobody had put it in writing except Nora Callahan, twice, in incident reports that had apparently gone nowhere. Walter Briggs had arrived at the ambulance bay on foot, or rather, on a walker, 20 minutes ago. He had not been registered. He had not been assessed. He had been told by the desk attendant to come around to the main entrance, fill out intake paperwork, and wait to be called. He had made it about 40 feet before his walker caught a seam in the pavement and he went down. Nora had been coming off a supply run when she saw him fall. She had not gone back inside to register him. She had not called for a gurney and waited. She had gone straight to him, assessed the wound, and started treatment on the pavement. That was the situation when Marcus Yusuf pushed through the ambulance bay doors. He was a tall man, broad-shouldered, always in a pressed shirt, and a tie that probably cost more than what most of his nurses made in a day. He had the kind of face that defaulted to authority, not earned, just assumed, the way some men walked into rooms expecting arrangement in their favor. He was on his phone when he came through the doors, mid-sentence, and then he stopped. He looked at Nora. He looked at the needle. He looked at Walter. He ended his call. "What is happening here?" It wasn't a question. Nora didn't look up. Patient presented with a laceration to the left calf, approximately 4 centimeters, deep tissue involvement. He fell in the bay. "I'm closing it." "You are performing a procedure on an unregistered patient," Yusuf said, "on hospital property without authorization." "He was bleeding on the pavement. That is not—" Yusuf stopped himself. Reset. "You do not initiate clinical contact before registration. That is protocol. That is policy. That is non-negotiable." Nora tied off the 3rd suture, started the 4th. "You can bill me later," she said. "Right now, he needs to live." The words weren't theatrical. She didn't say them for effect. She said them the way someone states a fact about the weather. And then she went back to work. And somehow that was worse than if she'd argued. Yusuf's jaw tightened. A small cluster of people had gathered, nurses, an orderly, 2 residents who'd come out for fresh air and were now very still. Donna had not moved. Priya had her phone out but wasn't recording yet, just holding it. "Stop what you're doing," Yusuf said. Nora placed the 4th suture. "I said stop." "I'll stop when it's closed." "You are in violation of—" "Mr. Yusuf." She finally looked up at him, and her eyes were the flat gray-green of deep water. No fear in them, no defiance either, exactly. Just a kind of settled certainty. "This man is 70-something years old, and he is on blood thinners based on the rate and color of this bleed. If I stop now, he loses this leg at minimum. So I'm going to finish, and then I'll come to your office, and you can do whatever you need to do." Silence. Walter Briggs made a soft sound. Not pain, more like relief. Because the 5th suture was going in, and the bleeding was almost entirely controlled. Then Marcus Yusuf did something that nobody in that parking lot expected. He stepped forward and grabbed Nora's arm, not firmly, not as a warning. He yanked it, pulling her hand away from Walter's leg, and when she turned with the sudden off-balance motion of someone interrupted mid-motion, his open palm caught her across the left side of her face with a crack that echoed off the concrete walls of the ambulance bay. The sound was very specific. Not a slap the way it sounds in movies, softer, more liquid. This was hard and flat, and it bounced. Nobody moved. Nora's head had turned with the impact. She held that position for a moment, chin angled to the right, blonde hair forward over her cheek. Then she straightened. She put her free hand back on Walter's leg. She looked at Yusuf with that same still expression. "You just assaulted me," she said, "in front of witnesses." "You are terminated," Yusuf said. His voice had gone thin. "Effective immediately. Security will escort you out." Donna realized she was holding her breath. Walter Briggs was looking at Yusuf with an expression that was very hard to read. Not anger, not shock. Something slower and more deliberate, like a man who has seen enough of the world to recognize a moment when it happens. Nora looked down at him. "I need 40 more seconds to close this properly." "Take it," Walter said. She did. When she was done, she dressed the wound with the same efficiency, stood up, stripped her gloves, and dropped them in the biohazard bag the orderly was now holding out with the mechanical helpfulness of someone who didn't know what else to do. She looked at the assembled staff. Some of them couldn't meet her eyes. Then looked at Yusuf one more time. "I'll get my things," she said. She walked back inside. 2 security guards materialized within minutes, which told Donna that Yusuf had texted someone on his way out, which meant some part of this had been premeditated, or at least pre-expected. They escorted Nora Callahan to her locker, watched her take out a small backpack and a jacket, and walked her to the main entrance. She didn't look at anyone on the way out. Donna watched her go and felt something cold and specific settle in her chest. Behind her, she heard Priya exhale. That, Priya said quietly, was wrong. Which part? All of it. Walter Briggs had been helped inside, finally, belatedly, where a resident was now examining Nora's suture work with the barely concealed expression of a person who has just seen something they weren't expecting. He kept touching the edges of the closure and nodding slightly, the way people nod when math comes out right. "Who did these?" the resident asked the orderly. "The nurse they just fired." The resident looked up. "You're serious?" "She did it on the pavement, in the rain." He looked back at the sutures, touched one edge again. "These are better than what I would have done in here," he said, half to himself. Then, catching himself, "Get him admitted, get his INR checked. I want to know his medication list." Walter let them work. He was patient in the way very old men sometimes were. Not passive, not resigned, but settled into themselves, like they've learned that urgency doesn't always belong to the person who feels it most. He let them take his blood pressure. He answered their questions. He told them about the walker and the pavement and the rain. He did not mention the phone call. He'd made it quietly, while Nora was still being escorted inside. His phone was old and heavy, and he held it the way people held phones before smartphones became an extension of the hand, deliberately, like a tool. He dialed a number he'd had memorized for years, the kind of number that doesn't change because it doesn't need to. It rang twice. A voice answered, professional, immediate. "Briggs, good to hear from you. What do you need?" "I need you to run a search for me," Walter said, and his voice had changed from what it had been in the parking lot. It was still quiet, but something else had entered it. Precision. Halverton General Medical Center, Caldwell, Oregon. A nurse. Blonde, early 30s, name is Nora Callahan. She just got fired. A pause. Keyboard sounds. "Give me 4 minutes." Walter watched a nurse check his IV line. He watched the overhead lights blink once, the way hospital lights did when the electrical load shifted. He listened to the ER sounds, the monitors, the soft rolling of wheels on linoleum, someone crying quietly behind a curtain, and he waited. 2 minutes and 40 seconds later, the voice came back. It was different this time, quieter, more careful. "Briggs," the voice said. "Where exactly did you say this hospital was?" "Caldwell, Halverton General." "And this woman, she treated you, clinically?" "Sutured a leg wound in the parking lot. 4-centimeter laceration, clean closure, 5 sutures. Correct technique, correct tension. In the rain, without a kit." Another silence. Longer this time. "Walter, the person you're describing has a classified service record. I'm going to need to make some calls." "I know," Walter said. "How did you know to call me?" "Because," Walter said, "I've seen hands work like that before. Only in one context." Donna didn't know about the phone call until later. What she knew was that Marcus Yusuf had returned to his office with the tight-shouldered stride of a man who believed he'd handled a situation, and that the ER had returned to its regular rotation of crises and quiet spells and the low-grade organized chaos that defined every Tuesday night. She knew that Priya had filed a complaint with HR before the end of the hour, and that at least 2 other nurses had indicated they would sign on to it. She knew that the resident, his name was Tobias Webb, second year, usually confident, had spent 20 minutes after examining Walter's sutures asking everyone who'd been in the bay what exactly the nurse had used and how long it had taken her. She didn't measure anything, an orderly named Jean had told him. She just knew. Knew what? The depth, the tension, how far apart to place them. She didn't look it up. She didn't ask anyone. She just did it. Tobias had written something in his notes and then crossed it out. What Donna didn't know, what none of them knew, was what was happening in the air above Caldwell at that exact moment. She found out at 9:47 p.m. when the windows shook. It started as a vibration in the floor, the kind that made the equipment tremble slightly on its carts and made everyone look up from what they were doing. Then it became sound, deep, percussive, mechanical. The specific thunder of rotor blades at low altitude. The overhead lights in the ER flickered once. Someone near the window said, "What is that?" And then a Navy helicopter descended into the parking lot of Halverton General Medical Center. It wasn't small. It wasn't subtle. The rotor wash flattened the decorative shrubs along the entrance walkway and sent a nurse's paperwork spiraling into the air. The landing lights cut through the October dark like something industrial, something that belonged at sea or in a forward operating base, not in the parking lot of a community hospital in Caldwell, Oregon. The ER doors opened before it had fully touched down. 3 people came through them. The one in front was not difficult to read. He wore his rank the way Walter Briggs wore his age, without announcement, as a simple fact of what he was. His uniform was navy, his posture was the kind that doesn't soften in civilian spaces, and the 2 sailors flanking him were carrying themselves with the alertness of people who had been told this was not a social call. Commander James Harlow walked to the nurses' station with the calm forward momentum of a man who has entered rooms under significantly worse conditions than this and found what he came for every time. He stopped at the desk. He looked at the nurse behind it, a young man named Eli, who had been on the job for 8 months and was currently experiencing the specific paralysis of a person who has just watched a military helicopter land in the parking lot and is not sure what protocol covers this. "I'm looking," Harlow said, "for the nurse who treated a patient in the bay approximately 1 hour ago. Elderly male, leg laceration. Her name was given to me as Nora Callahan." Eli opened his mouth, closed it. He stopped. "There was an incident, sir. She's no longer Where is she?" From behind Eli, Marcus Yusuf materialized. He'd apparently been alerted the moment the helicopter touched down, because he was here with the speed of a man who managed optics as carefully as budgets. He smoothed his tie. "I'm Marcus Yusuf, CEO of Halverton General. What can I do for you, Commander?" Harlow looked at him without warmth. "You can tell me where Nora Callahan is." "Ms. Callahan is no longer employed at this facility," Yusuf said. He had assembled something like composure. "She was terminated earlier this evening for a serious violation of hospital protocol. Patient safety. Where is she?" The repetition was flat. Not louder. Just flat. The way certain statements are when the person making them is not interested in alternatives. Yusuf's composure developed a hairline fracture. "She was escorted from the premises. I don't know where she... Who authorized her termination?" A pause. "I did," Yusuf said. "As CEO, I have the authority." "On what grounds?" "She initiated unauthorized clinical contact with an unregistered patient. That is a clear violation of..." "She sutured a man's leg in a parking lot. Without completing intake, while he was bleeding," Harlow said, "on the pavement, in the rain." The ER had gone very quiet. Donna was aware of every person in the room holding themselves still, in the specific way of people who understand they are witnessing something they should not interrupt. Yusuf straightened. "Commander, I understand this may seem... Do you know who Walter Briggs is?" Another pause. Longer. "He is a patient who was treated this..." "Chief Petty Officer Walter Briggs," Harlow said. "United States Navy, retired. 31 years of service. 3 deployments. Purple Heart, 2009. Yusuf said nothing. "He called someone," Harlow said, "after your nurse was fired. That call reached my desk 17 minutes later, and I was in the air 20 minutes after that." He let that settle. "Now, I'm going to ask you one more time where Nora Callahan is, and I'd like a useful answer." Yusuf looked at the people around him, the nurses, the residents, the orderly Jean, who was standing near the supply cart making no effort to be elsewhere. "She walked out the main entrance," he said. "That's all I know." Harlow turned to the sailor on his left. "Henderson." "Sir?" "Find her." Tab. Outside, the rain had finally committed. Nora walked with her backpack over one shoulder and her jacket not quite zipped because she'd done it wrong in the dark and didn't bother to correct it. The street outside Halverton General ran north toward downtown Caldwell, mostly quiet at this hour, amber streetlights making pools on the wet asphalt. She walked the way she usually walked, forward, at a pace that covered ground, not rushing. Her cheeks still ached. She'd checked it in the bathroom mirror before they walked her out, no visible marking yet, but it would color by morning. She pressed her fingers against it once and then stopped doing that. She thought about Walter Briggs. She thought about the way he'd said take it, not to comfort her, not as permission, but as a simple acknowledgement that she was right and should continue. The way soldiers talked when they trusted someone. Economical, no decoration, She wondered if he was okay. She thought he would be. The sutures were clean, the wound was closed, and if whoever reviewed her work was halfway competent, they'd keep him overnight for observation given his medication profile. She hoped they'd give him his dinner before 8. Old men on blood thinners didn't do well when their meal schedules got disrupted. She was 3 blocks from the hospital when she heard the footsteps. She didn't stop walking. She cataloged them. One person, solid gait, military cadence, not trying to be quiet but not announcing either. Someone who moved like they were used to purpose. Callahan. She stopped. She turned around. The sailor, young, 20-something, professional, stood about 10 feet back. He had the carefully neutral expression of someone following orders they hadn't been given the full context of. "Commander Harlow would like to speak with you, ma'am." Nora looked at him for a moment. She looked at the rain. She looked back at the direction of the hospital, where, even from 3 blocks away and through the dark, she could see the shape of the helicopter's tail rotor rising above the parking structure. Something in her chest did something she recognized but didn't particularly welcome. A tightening, a pulling, like a compass needle swinging back toward a direction she'd decided to stop facing. "Who sent him?" she said. "I'm not at liberty to say, ma'am." "Briggs?" The sailor's expression didn't change, which was its own kind of answer. Nora exhaled slowly. She looked at the sidewalk. There was a crack running through the concrete at her feet, a long diagonal line where frost had worked its way in and expanded over several winters. She thought about 6 weeks of filing incident reports that went nowhere. She thought about a man bleeding on the pavement while 40 feet away, inside a warm building, people argued about paperwork. She thought about the sound a hand makes when it hits a face in front of an audience, and the way everyone had stood there, and the way none of them had moved. She thought about the things she'd told herself when she took this job. Quiet. Normal. Just nursing. Just forward. Just put the past somewhere it couldn't follow. She shouldered her backpack more firmly. "Lead the way," she said. The sailor turned and she followed him back toward the hospital, and the lights of the helicopter were very bright against the dark. And the rain came down in the particular way it does in Oregon in October. Patient, persistent, without apology. And somewhere inside Halverton General, Walter Briggs was lying in a hospital bed with his eyes open, waiting. His phone rested on the tray table beside him. He didn't check it. He already knew what was coming. What he didn't know, what none of them knew yet, was what Nora Callahan would say when Commander Harlow looked her in the eye and read her something from a file that was never supposed to see the light of a civilian hospital. That was a different kind of storm, and it was already on its way in. The rain hadn't let up. Nora walked back through it with the sailor 2 steps ahead of her, and she kept her eyes on the helicopter rather than the hospital entrance, because the helicopter was easier to look at than the faces she was about to face again. It sat in the lot with its rotors still, rain beating and running off the fuselage in thin silver lines, and it was big enough and military enough that 3 cars had simply parked crooked to avoid being near it, as if proximity to that much intention might be contagious. The sailor held the door she went through. The ER had not returned to normal. It had the specific charged stillness of a room where people are pretending to work while actually tracking one situation, and every set of eyes that found her did it the way eyes do when they're trying not to be obvious about it and failing. Donna Mercer was near the nurses' station. Priya Okafor had come back from wherever she'd gone. Tobias Webb was standing at the edge of the corridor with a tablet he wasn't looking at. Marcus Yusuf was still there. That surprised her. She'd half expected him to retreat to his office, put a door between himself and the consequences of the last 2 hours. But he was standing near the desk with his arms loosely crossed, and when she walked in, his jaw tightened in the specific way of a man who has committed to a position and will not be moved from it, regardless of new information. Commander Harlow was 6 feet from him, and the distance between them had the quality of something deliberate. He turned when Nora came through the door. He was older than she'd expected from the sailor's description, mid-50s, weathered in the way outdoor and overseas work weathers people, with gray at his temples and the kind of eyes that had done a lot of assessment in difficult light. He looked at her face, at the cheekbone that was beginning to show color, and something moved through his expression that he controlled quickly. "Ms. Callahan," he said. "Commander?" His chin came up slightly. Not surprise exactly, familiarity with the rank. "You know why I'm here," he said. "I have a guess. Walk with me." Yusuf stepped forward. Anything discussed on hospital premises regarding a former employee is subject to Mr. Yusuf? Harlow didn't raise his voice. He didn't need to. I wasn't speaking to you. Yusuf stopped. Nora followed Harlow toward the far end of the corridor, where a row of plastic chairs sat empty beside a vending machine that hummed. The sailor named Henderson posted himself at a discreet distance. The second sailor stayed near the entrance. Harlow stopped at the chairs but didn't sit. He faced her. Chief Briggs called a contact of mine, he said. The call was flagged because of the name attached to the search query. Your name. I see. Do you understand why it was flagged? Nora looked at the vending machine. There was a bag of pretzels lodged against the glass, stuck halfway through a drop it had never completed. Yes, she said. Then you understand why I'm standing in a hospital in Caldwell, Oregon, at 10 o'clock at night. I understand why someone sent you, she said. I'm not sure I understand what you expect to happen next. Harlow was quiet for a moment. He had the patience of someone who had waited out longer silences than this in worse places. When did you transfer to nursing? 14 months ago, finished the accelerated RN program at Cascades Community College. Board certified 8 months after that. And you took a position here, Halverton General. It was hiring. There are hospitals closer to Portland, closer to a lot of things. I wanted something quiet, she said. He looked at her cheek. How's that working out? It wasn't quite a joke. She didn't quite smile. But something in the air between them shifted a degree. The recognition of two people who communicate in the same shorthand, even after years and context changes and different uniforms. The patient, Nora said. Walter Briggs? He's okay? He's comfortable. Resident says the sutures are good. His INR, they're monitoring it. He's stable. Harlow paused. He told them you knew about the blood thinners before you had his chart. The bleed pattern, color and rate. It wasn't a guess. No, Harlow said. It wasn't. He reached into his jacket, not dramatically, just the motion of someone retrieving something they need, and pulled out a phone. It was not a consumer device. The case was matte black, and the screen required a specific authentication that he completed with the practiced automaticity of someone who did it constantly. He turned it toward her. She read the first 3 lines and stopped. Her face did nothing visible, but something behind it rearranged itself. You pulled my file, she said. It pulled itself, he said. The moment Briggs ran your name through the right channel, the system flagged it. I didn't go looking. It came to me. That record is classified. Yes. Classified records don't sit on. They do, he said, when the person attached to them does something that warrants verification. A combat-trained medic suturing wounds in a civilian parking lot is a verification event. He pulled the phone back. You were embedded with SEAL Team 8 during the Carmen operation. I was a Navy corpsman attached to a special operations unit, she said. That's all I'll confirm. The file says more than that. The file can say whatever it wants. Harlow looked at her for a long moment. There was no frustration in it. If anything, there was something that might have been understanding. Nora, I'm not here to drag anything out of you. I'm here because a man who served 31 years called me, and because what I read in that file in the 20 minutes between landing and walking through that door tells me that the woman who got fired tonight for treating a bleeding veteran on the pavement is someone this hospital doesn't have the first idea they were dealing with. She said nothing. And I think, he said, that's exactly how you planned it. Still nothing. He put the phone back in his jacket. I need to go speak with Walter. Will you wait? She looked toward the ER, toward the faces that had been pretending not to watch them. Donna had stopped pretending. She was just watching, openly, with the expression of someone trying to solve a problem they don't have all the pieces for. I'll wait, Nora said. Walter Briggs was in Bay 4, elevated on the bed, his bandaged legs stretched out and his walker folded against the wall. He had eaten half of a turkey sandwich that someone had brought him without being asked, and he was working on a cup of coffee that was not good but was hot, which was the more important variable. Harlow came in and pulled the curtain. You look better, Harlow said. I look the same, Walter said. Sit down, James. Harlow sat. For a moment, neither of them spoke. This was the kind of silence that belongs to people who have shared bad hours together. Not comfortable exactly, but familiar. Harlow had been a lieutenant commander during Walter's last deployment. They had not served side by side, but they had shared a forward operating base for 11 weeks, in a place neither of them named in civilian company, and that kind of proximity counted for something. "You knew," Harlow said. "When you called me, you already knew who she was." "I suspected," Walter said. "Hands like that. The assessment, the speed, the way she talked to me. Not soothing, not nervous. Direct, like someone used to patients who needed information, not comfort." He set down the coffee. "I've seen that approach before. In one context. She's been here 6 weeks. I know. I asked one of the nurses while they were setting up my IV. She didn't recognize you? No reason she would. She was attached to 8. I was support staff on a different team, different rotation. We were never introduced." Walter looked at the curtain, as if he could see through it to wherever Nora was. "But I've been briefed on what 8 did during Carmen. Everyone above a certain clearance level was, afterward. What she did during that operation..." He stopped. "James, what that woman did to keep those men alive, the conditions she worked in, the decisions she made." Harlow waited. "The file doesn't capture it," Walter said. "Files never do. But I've read it, and I've talked to men who were there, and I will tell you that what she did in that parking lot tonight, sutured a leg in the rain with whatever she had in her pocket, that's not impressive because it's technically skilled. It's impressive because it's nothing to her. That's Tuesday for that woman. That's the minimum." Harlow was quiet. "And this hospital," Walter said, "fired her for it. The CEO, I know what the CEO did." Walter's voice didn't rise, but it compressed, the way pressure compresses before it moves something. "I was conscious for all of it. I heard everything. I watched him grab her arm, and I watched what he did after that." His hands, resting on the blanket, had gone very still. "I spent 31 years serving so that people like her could exist. People who run toward the bleeding. People who don't ask about paperwork when someone's losing a leg." He looked at Harlow directly. That man put his hand on her face. "I know. What are you going to do about it?" "Right now," Harlow said. "I'm going to go talk to her. And then I'm going to decide what comes next." He stood. "But, Walter, I want to be honest with you. Whatever I do, whatever this becomes, it has to be her decision. She left. She built something quiet here. I'm not going to bulldoze that." Walter nodded slowly. "Talk to her," he said. "Just let her know that someone knows. Sometimes that's the thing. Just being seen." He said. Nora was where he'd left her, in the chair by the vending machine, and she had not moved in the 22 minutes he'd been with Walter, which told him something about her ability to be still in uncertain situations. Her jacket was finally zipped. She had her hands folded in her lap, and she was looking at the middle distance with the expression of someone running calculations. He sat down beside her. "He told me to let you know," Harlow said, "that he remembers the Carmen briefing." Something crossed her face. Brief, unguarded, and then gone. "He wasn't there," she said. "No, but he was briefed. Afterward." Harlow leaned forward, elbows on his knees. "The men you brought out of that valley. 8 of them. 3 were critical. You worked on them for..." "I know what I did. 7 hours," he said. "Under fire, with a kit that was depleted by hour 2. The after-action report says you improvised with field dressings, tourniquet material, and at one point a piece of communications wire to close a chest wound. The report," she said, "was written by someone who wasn't there." "Were they wrong?" She looked at the vending machine, the stuck pretzels. "They were accurate," she said. "They just made it sound like more than it was." 8 men came home. 7, she said. 7 came home. The correction landed between them. Harlow absorbed it without trying to smooth it over, which was the right call. "I'm sorry," he said. "It was 3 years ago." She said it the way people say things they have said many times to themselves, wearing the words down to something they can carry. Outside, the rain continued. Somewhere in the ER, a monitor beeped in a steady, unconcerned way. The vending machine hummed. "What do you want to happen here, Nora?" Harlow asked. "Tonight. This situation. I want Walter Briggs to go home healthy," she said. "That's what I wanted 3 hours ago. And the rest of it." She was quiet. Then, "I didn't come here to fight anything. I came here to do nursing, to do it cleanly and not make it complicated. You filed 2 incident reports in 6 weeks. Because 2 things were wrong. That's not someone who came here to stay quiet. She almost said something, stopped, started differently. I came here to do the job right. That's different from picking fights. She looked at her hands. He hit me in front of 40 people, Commander. That's not about me. That's about the next nurse he decides isn't compliant enough. That's about the patient who bleeds out in a parking lot because nobody will touch them before registration. Harlow nodded. So what do you want? I want it to mean something, she said. Whatever happens next. I want it to mean something for the people who work here and the patients who come through here. Not for me. He studied her profile for a moment. The cheekbone was darker now, the bruising coming up properly. She held herself in a way that acknowledged the pain without performing around it, which was something he recognized from people who had learned to carry damage without letting it change their baseline. Okay, he said. He stood. Then let me go back in there. She looked up. Why? Because I have a classified file on my phone and 2 sailors in the lobby and a CEO who just assaulted a decorated combat veteran and thinks he's going to walk back to his office and write a termination notice. He straightened his jacket. And because Walter Briggs asked me what I was going to do about it, and I told him I hadn't decided. Have you now? Getting there, he said. Come with me. Marcus Yusuf had, in fact, retreated to the lobby adjacent to the ER, where he was on his phone, not calling anyone, Donna noticed, just staring at it the way people stared at phones when they needed to look occupied. His composure had rearranged itself into something that resembled authority, but the edges of it were fraying in small ways. The top button of his shirt was now open, the lanyard slightly askew, the tie loosened by half an inch. He saw Nora come through the corridor behind Harlow, and his jaw set. Commander, he said, whatever Ms. Callahan has told you, I want to be clear that this hospital's protocols exist for patient safety reasons, and her termination was entirely within my authority as, I heard you the first time, Harlow said. He stopped in front of Yusuf at a distance that was professional but not comfortable. I want to tell you something, and I'd like you to listen to the whole thing before you respond. Yusuf pressed his lips together, nodded once. The nurse you fired tonight, Harlow said, is a former United States Navy corpsman who served in a classified special operations capacity. Her medical training is significantly beyond standard nursing certification. It includes combat trauma, field surgery, mass casualty triage, and improvised intervention under live fire conditions. The sutures she placed on Walter Briggs's leg in your parking lot tonight represent about 1% of what she is actually capable of. Yusuf blinked. Once. Something moved behind his eyes. Reassessment, recoil, the beginning of a calculation he hadn't anticipated needing to run. The incident report she filed 6 weeks ago, Harlow continued, and the one before that, I had my people pull them in the last hour. Both identified protocol failures that put patients at risk. Both were dismissed without review. He paused. The patient you put her on administrative warning for last month, the one she flagged for sepsis symptoms before the attending caught it, was admitted to the ICU 48 hours later. He survived. The lobby had gone very quiet. Donna was aware of at least a dozen people within earshot. Priya had come to stand near the corridor entrance. Tobias Webb had given up the pretense of the tablet entirely. Even the 2 sailors near the entrance were still. I'm not a lawyer, Harlow said. I'm not here to tell you what your legal exposure looks like, but I am going to tell you that what you did in that ambulance bay tonight was witnessed by multiple staff members, that it was an assault, and that the woman you assaulted has a service record that is going to raise some very specific questions about your judgment when this becomes public. He let that sit for 3 full seconds. And it will become public. Yusuf's jaw worked. He looked at Nora. Some emotion crossed his face that was too complicated to read quickly. Anger, maybe, but also something closer to the sick recognition of a man who has just understood the full weight of what he put his hand into. I acted within... Mr. Yusuf, Harlow said, and the flatness in his voice was something final. I strongly suggest you call your board. The next 30 minutes happened in the particular compressed way that consequential time often moved. Too fast in memory, too detailed in the moment. Yusuf made a call from the lobby. Donna couldn't hear it, but she watched his body language shift through 3 distinct phases. defensive, then explanatory, then something that looked like a man being told things he didn't want to hear. When he came back in, he was not on the phone anymore, and whatever authority his posture usually carried had developed a structural problem. Harlow had not left. He'd positioned himself near Walter's bay, where Walter was now sitting up and had been brought up to speed by the sailor Henderson in the efficient, minimal way of military communication. When Donna went in to check vitals, she told herself it was because she was assigned to him, which was partially true. Walter was looking at the ceiling with the expression of a man reviewing a situation and finding it in order. "How's the leg?" she asked. "Fine," he said. "Better than fine. That woman knows what she's doing. She did it in the rain. I know. I was there." He looked at Donna with eyes that had seen more of the particular kind of things humans did to each other and to themselves than most civilian faces suggested. "She's going to be okay. Whatever happens with all this, she's going to be okay. That kind of person always finds their footing." "She got hit," Donna said. "It came out more raw than she intended." "I know that too." He was quiet. "I've been carrying that since it happened. That's on me. I got her into this situation by needing a leg stitched. You didn't ask him to—" "No. But I was the reason she was there, like—" He looked back at the ceiling. "I'll carry that. But she wouldn't want me to make it about the hit. She'd want it to be about the rest of it." Donna wasn't sure what the rest of it was, exactly. She was about to ask when her pager went off. Trauma call. Bay 2. She went. Because that was the job, and the job didn't care what else was happening. The trauma was a car accident. 2 vehicles, wet road, the intersection 4 blocks north that everyone who worked at Halverton General mentally flagged as the one that kept feeding them patients. A 23-year-old with a suspected pneumothorax and a 50-something with a broken radius and a head lack that looked worse than it was. Standard bad Tuesday night. What was not standard was what happened when the paramedics brought the second gurney in. The 23-year-old's oxygen saturation was dropping. The resident on call, a first-year named Garza, who was competent but not yet fast, was trying to assess while simultaneously managing the controlled chaos of 2 simultaneous admissions. And his hands on the chest auscultation were slightly wrong, the stethoscope placement catching the wrong field, and the reading he was getting was therefore slightly wrong. And he was about to act on a slightly wrong reading in a situation where slightly wrong could mean collapsed lung on the wrong side. Nora was in the corridor. She had not been invited back in. She had followed Harlow back inside because he'd asked her to come with him. And she'd been standing near the vending machine area again because that seemed to be her corner now. And she was close enough to the bay that she could hear the monitors, and she could hear Garza's voice, and she could hear the number the respiratory tech was calling out. She was through the bay curtain before she'd decided to move. "Garza." Her voice was not loud. It was the specific kind of not loud that cuts through noise anyway. "Left thorax, not right. You're getting tracheal deviation on the—" "I've got it," Garza said, reflexively defensive. "You've got the wrong side." She was already beside him, not pushing him out, just repositioning, her hand on the stethoscope. "Listen here. You hear that?" He listened. His face changed. "Needle decompression left side," she said. "Now." He did it. The patient's sat started climbing within 90 seconds. Nobody said anything for a moment. Then the respiratory tech, a quiet man named Marcus, who was not the same Marcus as the CEO and went by his last name, Tully, said, "How did you—" "From the corridor." Nora stepped back. She was still not supposed to be in here. She was not an employee of this hospital. She was aware of that in the specific way she was aware of her bruised cheekbone. Present, acknowledged, not controlling. "The numbers," she said. "The rate and the curve on the SAT monitor. And I could hear the percussion difference through the curtain." Tully looked at Garza. Garza was staring at his patient, who was breathing better, whose color was visibly improving, and who would not know until much later that a fired nurse with rain still in her hair had heard him deteriorating through a curtain and walked back in anyway. "You heard percussion," Tully said. "Through a curtain. It's not—" Nora stopped. "It's pattern recognition. I've done a lot of chest work." "In nursing school." She didn't answer that. Garza turned around. He was young, and his pride was a real thing that existed in the room with them, but he was also not an idiot, and he had enough self-awareness to understand what had just happened and what it meant. Thank you, he said. It cost him something, but he paid it. He's going to need a chest tube, Nora said. Get thoracic down. Then she walked back out. Donna caught all of it from the edge of the bay. She had finished with the headlock patient and had been about to circulate when Nora moved past her going in, and she'd stayed to watch, because whatever was happening tonight had the quality of something she needed to witness completely. She found Priya in the break room 10 minutes later. Did you see the Bay 2 call? Donna said. I heard it. Priya was making tea with the focused attention of someone who needed something to do with their hands. Garza's talking to Tobias about it in the hall. She caught it from the corridor, through the curtain. Priya looked up. Through the curtain. She said she heard the percussion difference. Priya put down the tea. Donna, what is this woman? And Donna didn't have an answer, because the honest answer was that she didn't know, and every new piece of information she got made the shape of it larger and more complicated and less like anything she'd expected when she showed up for a Tuesday night shift. What she knew was this. Nora Callahan had arrived 6 weeks ago with a quiet manner and slightly crooked lanyard and filed 2 incident reports that nobody read. She had been fired for treating a veteran in the rain. She had been slapped in front of 40 people. She had walked out the main entrance into the dark. And now she was back inside, having just saved a 23-year-old from a misidentified pneumothorax, and there was a Navy helicopter in the parking lot, and the CEO of the hospital was somewhere making calls with the energy of a man who had realized his ground was not what he thought it was. I don't know what she is, Donna said, but I think we all just found out we should have. Harlow had watched the Bay 2 situation from the corridor. He had not intervened because there was nothing to intervene in, nor had handled it before intervention was relevant, but he had watched it with the particular attention he brought to situations that confirmed things he already suspected. When she came back out, he fell into step beside her. You can't help it, he said. Not accusatory, almost wondering. The kid was about to needle the wrong side. I know, I watched. So nothing. He paused. I'm observing. Observe somewhere else, she said, but without heat. More like the automatic deflection of someone who wasn't fully comfortable being studied. They walked to the end of the corridor. Through the window, the helicopter was still visible, and the rain had gentled to a drizzle that made the parking lot lights bloom. Here's where I am, Harlow said. I called my commanding officer from the lot after I landed. The situation with your record, the flag, Briggs's call, all of that went up the chain in the 90 minutes I've been here. There are people paying attention to tonight who were not paying attention 3 hours ago. Nora was looking at the window. What does that mean? It means that whatever happens with the CEO, whatever the board does or doesn't do, this isn't going away quietly. Not anymore. She turned to look at him. I didn't ask for this. I know. I built this specifically to be quiet. I know that too. His voice had something in it that wasn't quite sympathy, but was adjacent. But Nora, you filed 2 incident reports. You went back outside for a patient who'd fallen in the bay. You walked back in here 20 minutes ago to catch a pneumothorax in the wrong side. He looked at her steadily. The quiet you built, it's made of glass. Every time something goes wrong, you walk through it. She opened her mouth, closed it. Because he wasn't wrong, and she knew he wasn't wrong. And that was the specific, uncomfortable thing about this conversation. What do you need from me? She said finally. Tonight? Nothing. He checked his watch. The board is being contacted. My CO has been briefed. The sailors will stay until the situation with Yusuf is formalized. You should go home. Walter is stable, is comfortable, has my direct number. Harlow looked at her. Go home, Nora. Sleep if you can. Tomorrow is going to ask things of you, and you should have something in reserve. She nodded once, the motion of a person who accepts information and will process it privately. She picked up her backpack from where she'd set it against the wall. She zipped her jacket, correctly this time, he noticed. She started toward the exit. Halfway there, she stopped. She turned back. Commander? Yeah. The chest wound during Carmen. She said it without looking at him directly, angled slightly away, the words addressed to the middle distance. The communications wire. The report says I improvised. It wasn't improvisation. It was a technique that one of the operators had taught me 3 weeks before the ambush. He'd learned it from a corpsman in a previous deployment who'd learned it from someone else. She paused. The man who taught me didn't make it out. Harlow said nothing. His name was Torres, she said. Petty Officer First Class. I want that in whatever file gets updated. I want it on record that what I did that night, I did because of what he taught me, not because of me. She didn't wait for a response. She pushed through the ER doors and walked out into the drizzle, and Harlow stood in the corridor of Halverton General and looked at the space where she'd been and felt the particular weight of someone who has just been trusted with something that matters. He took out his phone. He opened the file. He typed a note at the bottom of the field marked Supplemental. Petty Officer First Class Torres. Record update requested. Per subject. He saved it. Then he walked back toward Walter's Bay because there was more to talk about, and the night was not done with any of them. And somewhere in this hospital, a board of directors was about to receive a phone call that would change the direction of everything Marcus Yusuf had built. Harlow had been in enough situations to know when the ground was shifting. He could feel it now, slow, fundamental, the way tectonic things moved. Not dramatic, just certain. What none of them had yet seen was the document Henderson had just pulled up on his secure tablet at the lobby entrance. A secondary search result that had come through on the delayed clearance channel, attached to Nora's file, flagged 3 years ago and never acted on. Henderson read it twice. He read it a third time. Then he walked quickly toward Bay 4, because Commander Harlow needed to see this before morning, and what was in that document was going to reframe everything that had happened tonight in a way that nobody in Halverton General was prepared for. Henderson moved fast for a man carrying something he didn't fully understand. He covered the distance from the lobby to Bay 4 in 30 seconds, weaving past a gurney being repositioned and a cart of IV supplies that someone had left at an inconvenient angle, and when he pushed through the curtain, Harlow was mid-sentence with Walter Briggs about something logistical that immediately became irrelevant. Sir. Henderson held out the tablet. Secondary search return on Callahan. Just came through the delayed clearance channel. You need to see page 3. Harlow took it. He read standing up the way he read most things, quickly, absorbing in chunks, his expression doing very little. Walter watched him from the bed with the particular patience of someone who has learned that the fastest way to get information is to not ask for it. Harlow got to page 3. He stopped moving. Not dramatically. He just went still in the way that people went still when something required all available processing. Walter said, James. Give me a minute. He read it again. Then he looked up at Henderson. When did this come through? 4 minutes ago. It was in a secondary file attached to the main record, separate clearance level. Took the system longer to surface it. Who else has access to this tier? At my level? Nobody currently in this building. Harlow handed the tablet back. He stood with his hands loose at his sides and looked at the wall of Bay 4, which was pale green and had a small scuff mark near the light switch from some previous piece of equipment, and he appeared to be doing something internal that required the visual field to just be a surface rather than something worth seeing. What is it? Walter asked. Harlow looked at him. Decided. 3 years ago, 2 weeks after the Carmon operation, there was an inquiry. Internal, Naval Special Warfare Command. It concerned the conduct of the medical personnel during the mission. Walter's eyes sharpened. An inquiry into her conduct. Into the decisions she made during the 7 hours. Specifically, he stopped. Started again. One of the operators she treated. His injuries were severe. The inquiry questioned whether she prioritized correctly, whether her triage sequencing was correct, whether a different order of treatment might have saved the man who didn't come home. The bay was very quiet. They cleared her, Henderson said. It's in the file, full exoneration. Inquiry closed. But the inquiry existed, Walter said. His voice had gone flat. Someone questioned her, after. Someone wrote a report, Harlow said. The report went to her commanding officer. It was dismissed, it was closed, she was formally cleared, but the report itself, it's in her file, which means anytime her file gets accessed with sufficient clearance, she sees it again, Walter said. It's there every time. The three of them sat with that for a moment. The monitor beeped its steady rhythm. Somewhere beyond the curtain, the ER continued doing what it did. Who filed it? Walter said. Harlow looked at the tablet Henderson was still holding. A lieutenant commander named Reyes. He was the ranking officer on site during the post-mission debrief. He's currently... He checked. He retired 14 months ago. Same time she left, Walter said. Harlow looked at him. She left 14 months ago, Walter said. Started the nursing program. Same window. Neither of them said what they were both thinking, which was that a formal inquiry, even a dismissed one, even one that ended in full exoneration, left marks, on paper and otherwise, and that a woman who had spent 7 hours keeping 8 men alive under fire and then been formally questioned about whether she'd done it correctly, that woman might make very specific choices about where she went next, about how quiet she tried to be. Does she know it's still in there? Walter asked. I don't know, Harlow said, but I need to find out. He was already moving when Walter said, James? He stopped. Carefully, Walter said. Whatever you do next. Carefully. Nora was 3 blocks from the hospital when Harlow's phone reached her. She had her own cell, and she'd given the number to Henderson without thinking much about it. The automatic compliance of someone accustomed to operating within structures that needed your contact information. When it rang and she saw the unfamiliar number, she almost didn't answer, but she was 3 blocks from a hospital where a Navy helicopter was still parked, and the context made the call predictable. Callahan? It's Harlow. Where are you? Walking. I need you to come back. She stopped on the sidewalk. The drizzle had gentled further, barely rain now, more like the air itself was damp. You told me to go home. I know what I told you. Something came up in the file. Secondary return, higher clearance tier. I need to talk to you about it before it goes any further up the chain. The silence on her end lasted long enough that he thought the call had dropped. Is it the inquiry? She said. He hadn't expected that. You know about it. I know it's in there. Her voice had changed. Not broken, nothing that dramatic, but it had lost the controlled flatness of the last few hours, and something underneath had surfaced. Something tired. I was told it was closed. I was told it was expunged. It was closed. It wasn't expunged. There's a difference in... I know the difference, she said. She stopped. I was told it was expunged. By who? Reyes. Harlow absorbed that. He told you it was expunged. He told me it was gone, that there was no record, that the inquiry never happened formally. She was quiet for a moment, and then he retired, and I left. Nora, come back to the hospital. Why? Because right now that document is sitting on Henderson's tablet, and I'm the only one who's read it at this facility, and I'd like to discuss what you want to do about it before it goes to my CO and becomes part of a larger conversation that you should have input into. Another silence. Shorter. I'll be there in 5 minutes, she said, and ended the call. She came through the main entrance this time, not the ER bay, and the difference was small but visible. She was someone re-entering on her own terms rather than being escorted. The security guard at the desk looked up, recognized her, and had clearly not been updated on what his protocol was supposed to be regarding this specific person tonight, so he defaulted to saying nothing, which was the right call. Harlow met her in the corridor outside Bay 4. He handed her the tablet without preamble. She read it. He watched her read it and saw the moment she got to the part she hadn't known. Not the inquiry itself, which she'd known about, but the specific language of the closing remarks. The way Reyes had written the exoneration. Her jaw tightened. He cleared me, she said, but he wrote this. Yes, he wrote that my decision to prioritize Torres over Weston in the first 90 minutes was... She stopped reading aloud. She kept reading silently. Then she put the tablet down. Weston survived, she said. Torres didn't. And Reyes wrote this to explain why. He was covering the decision tree, creating a record that... He was covering himself, she said, in case Weston's family asked questions, in case anyone asked why Torres died when Weston didn't. Her voice was very controlled, too controlled, the specific over-control of someone managing something that is trying to come apart. Torres had a tension pneumothorax and a femoral bleed. Weston had a gunshot wound to the shoulder and a concussion. Weston was in better shape. I triaged correctly. Torres should have been savable. The report says... I know what the report says. I was there. She set the tablet on the narrow ledge beside the curtain and pressed her fingers against the edge of it. Torres died because we were 6 hours from any surgical facility and he threw a clot at R4 that I couldn't address with what I had. Not because I triaged wrong, not because I made the wrong call, because we were in a valley in the dark, and I had half a kit and a piece of communications wire, and I was doing things that weren't supposed to be survivable in those conditions. The words came out with the specific pressure of something that had been contained for a long time in a space slightly too small for it. Harlow waited until she was done. Then he said, "I know." "You don't know. You read a file." "You're right." He didn't argue it. "But the people above my clearance level who are going to see this tonight, they'll read it too, and the inquiry language will be the first thing they see." She looked at him. "Why are you telling me this?" "Because you deserve the chance to decide how it gets handled. The inquiry is closed, the exoneration is documented. But if this gets surfaced to the people currently paying attention to your name, the narrative matters. How it's framed matters." He held her gaze. "I can write a supplemental. I can request the inquiry language be contextualized against the after-action data. But I need you to give me the information I don't have. The timeline. The decisions. What you had, what you didn't, what happened to Torres, and why." She was quiet for a long moment. "You want me to defend myself," she said. Again. "I want to make sure the record is complete," he said. "That's different." She looked at the curtain to Bay 4, behind which Walter Briggs was presumably still awake and listening to the ER sounds with the patience of a man who understood how long nights worked. "Torres taught me the chess technique," she said. "He taught me 3 weeks before the ambush. In a quiet hour between rotations, he sat down with me and walked me through it, because he'd learned it from a corpsman who'd used it in a situation where it mattered, and he thought I should have it." She looked at her hands. "When the ambush hit, and he went down and I assessed him and understood what I was dealing with, I used his own technique on him, his own knowledge, his own hands, in a way, and I couldn't save him." She pressed her lips together. "I could save everyone else, but not him." The corridor was very still. "That's the thing Reyes never understood," she said. "Not that I triaged wrong, but that I knew Torres personally. I knew his hands, and I still had to make him wait while I stabilized the bleeds that were faster. That's not a triage error. That's the worst correct call you can make." She exhaled slowly. "I left because I didn't want to be in rooms where people were trying to decide whether it was my fault. I left because I already knew it wasn't, and I didn't have any more energy for other people deciding that for themselves." Harlow nodded slowly. He took the tablet back. "I'm going to write the supplemental tonight," he said. "Will you sign it?" "If it's accurate." "It'll be accurate." She nodded once. Then she looked toward the main ER area. "Is there anything else happening here that needs—" She stopped. Because there was something happening in Bay 2. Not an alarm, the monitors were alarmed, but that wasn't new, but a voice. And the voice was Garza's. And the specific pitch of it was something she recognized not from nursing school or from civilian hospital work, but from a much older and more fundamental place. She was moving before she finished the thought. The 23-year-old's name was Derek Paulson, and he was having a bad night that was getting worse. The chest tube had been placed correctly, and the pneumothorax was resolving, but his pressure had been trending down for 20 minutes in the incremental way that sometimes meant nothing, and sometimes meant internal bleeding. And Garza had been watching the number with the focused anxiety of someone who knew what it could mean, and was hoping the next reading would reverse the trend. It didn't. It went down again. "Get me a fast exam," Garza said, and then Nora was through the curtain and next to him before the tech had the ultrasound probe out. "What's his mechanism?" she said. "Driver, restrained, airbag deployed. Chest hit the wheel anyway, broke 2 ribs on impact." "His pressure?" 84/52 and dropping. Was 94 when he came in. She looked at the fast screen as Tully ran the probe. Fluid in Morrison's pouch. Not a little, enough that it was visible within the first sweep, the dark crescent of free fluid collecting in the hepatorenal space. "He's bleeding internally," she said. "Hepatic laceration probably. He needs OR now." "Surgical is—" Garza was already reaching for the phone. "It's 11 p.m. The on-call is, get them on the phone, tell them free fluid on fast, dropping pressure, chest trauma mechanism. They'll move." She turned to Tully. "RBC hanging? Type and cross is pending." How long ago did you send it? 40 minutes. Lab is, call them. Tell them it's critical. We need ONEG now while we wait for the cross. She looked at Garza. Who's the surgical attending? Dr. Vance, but she's at home. The resident on call is, call Vance directly, not the resident. Vance. She said it without apology for overstepping, because the math of the situation left no room for apology. This is going to need an attending's hands. Garza was on the phone. He was not arguing. He was a second-year resident in the specific situation of knowing enough to understand what he didn't know, and what he didn't know in this moment was how to want to do anything other than what the woman next to him was telling him. Nora was adjusting the IV rate. 2 large-bore lines, both running, and she titrated the crystalloid because too much fluid before surgical control of the bleed was its own problem. Pressure too high, and you pushed the clot. Pressure too low, and perfusion dropped. And the needle you were threading in those minutes was one that punished both sides of the error. His GCS, she asked a nurse near the head of the bed. 12 when he came in, 10 now. He's altered from the drop. Keep talking to him. She looked at the nurse, young, wide-eyed, competent, but scared. Not reassurance. Information. Tell him what you're doing. Altered patients orient better to data than to comfort. The nurse nodded and turned back to Derek Paulson and said, in a voice that was steadier than her expression, Derek, we're getting blood products set up for you, and a surgical team is coming. Your heart is working hard right now. I need you to stay awake for me, okay? Derek Paulson, 23 years old, made a sound that was trying to be words. His pressure again, Nora said. 78/48. Where is Vance? She's coming in, Garza said. 20 minutes. He doesn't have 20 minutes before we need to make a decision about damage control. She looked at the monitor at the rate of descent, doing the math in real time that was not really math, but something older and more physical. Pattern, trajectory, the particular signature of a body losing more than it was keeping. Does this hospital have interventional radiology on call? Not overnight. Okay. She put her hands on the rail of the gurney. Okay. We keep him here, and we keep his pressure above 70 with packed cells as soon as they arrive, and we get Vance in the building before we move him. She looked at Garza. You agree with that plan? Garza blinked. She had asked him deliberately, not talked over him, asked him. Yes, he said. Yes, I agree. Then own it, she said. This is your patient and your bay. I'm standing here because I heard the numbers, but I'm not the physician. He straightened slightly. Right. And then with something firmer. Let's get that ONEG running as soon as it's up. Tully, keep the fast probe handy. I want a repeat scan in 10 minutes. Nora stepped back. Not out of the bay. Staying was necessary, but half a step. And it was a deliberate half step, the difference between assisting and directing. It was not a clean thing to do. It went against every reflex she had. But Garza needed to be the doctor in this room, and she needed to be the person who had made him better at being the doctor in this room. It was its own kind of discipline. From the corridor, Donna watched it. She had been watching Nora Callahan all night in the way you watch something you were trying to understand, accumulating data points, trying to build a picture that made sense of itself. What she'd seen in the last hour was not a person showing off. It was not someone performing competence for an audience. It was someone for whom the medicine was so fundamental that it moved through her like breathing, automatic, necessary, not remarkable to her even when it was remarkable to everyone watching. Donna had been nursing for 11 years. She had worked with excellent nurses and mediocre ones, and 1 or 2 who were genuinely dangerous. She had worked with physicians who were brilliant, and physicians who were terrifying, and a handful who were both at once. She had a calibrated internal instrument for clinical ability, the same way people who worked with sound developed a calibrated ear. What Nora Callahan was registering on that instrument was something she didn't have a word for. She went to find Priya. Priya was in the supply corridor making notes on her phone. The complaint she'd been drafting since approximately 20 minutes after Yusuf hit Nora in the parking lot had grown to 3 pages and now included the sepsis case from last month and the 2 ignored incident reports and tonight's termination and the assault and the Navy helicopter as context rather than primary complaint. Bay 2, Donna said. Priya looked up. I heard the trauma overhead. She's in there. She caught internal bleeding. Fast. Positive, dropped pressure. She's managing the bridge until surgical gets here. Priya put down the phone. She's not an employee, Donna said. She walked in off the street, technically, or she was escorted out and she came back. Does anyone care right now? Garza doesn't. Tully doesn't. Donna paused. I don't. Then nobody cares, Priya said. What's Yusuf doing? Donna had not checked on Yusuf in the last 30 minutes, which she realized now was itself a kind of answer to how the night's priorities had arranged themselves. Last I saw, he was in his office. The board rep is coming in person, Priya said. I just got a text from someone in administration. Evelyn Marsh. She's the chair. Donna processed that. Evelyn Marsh was not someone who came in person lightly. When? She's already in the building. Evelyn Marsh was 61 years old and had been chair of Halverton General's board of directors for 7 years, which meant she had outlasted 2 CEOs before Yusuf and had developed a reliable system for reading situations. She was a compact woman in a gray coat she hadn't taken off, and she moved through the hospital with the specific efficiency of someone who knew the building well but didn't work in it daily. She had received 3 calls in the last hour. The first from Yusuf, explanatory, defensive, and containing at least 2 factual inaccuracies she'd already identified by the time he finished. The second from her board vice chair, who had received a call from a hospital administrator who'd heard about the helicopter. The third from a number she didn't recognize, which turned out to be Commander James Harlow, who had introduced himself precisely and told her 3 things in the following order. That a nurse had been assaulted on hospital premises, that the nurse had a classified military service record, and that he was on site and available to speak with her at her convenience. She had been in her car 15 minutes after the third call. She found Harlow in the corridor outside Bay 4. He was a man who, she noticed immediately, did not perform authority. It was just present in him, the way certain materials had weight without announcing it. She respected that. She'd spent 7 years in boardrooms with people who performed authority constantly and accomplished very little. Commander Harlow, she said. Miss Marsh. He offered his hand. Thank you for coming. Where is Marcus Yusuf? His office, as far as I know. She looked toward the ER. And the nurse? Bay 2. There's a trauma case she's assisting with. Marsh looked at him with an expression that was asking a question without asking it. She was terminated, Harlow said, and walked back in twice because there were patients who needed her. Marsh was quiet for a moment. Show me her file, she said. Yusuf's office was on the 3rd floor, which was far enough from the ER that the sounds of the night didn't reach it directly, and he had been sitting in it for 40 minutes trying to reconstruct the evening into a version that held together. His legal team was on standby. He'd texted them at 9:50, just after the helicopter, which in retrospect suggested some part of him had known what he'd done even before Harlow said the word assault with that particular flatness. He had built a defensible argument. He knew how to do that. Protocol violation, clear documentation trail. The incident reports she'd filed were themselves evidence of pattern behavior. A nurse who consistently operated outside her lane, who had established a history of ignoring directives. He documented the first warning. He documented the second. The termination tonight was the logical conclusion of a documented pattern. The slap was harder to incorporate. He was not a man who used physical force. He knew that about himself. In 30 years of professional life, in meetings that had gone sideways and confrontations that had escalated, he had never put his hands on anyone. Tonight, something had broken open in him that he didn't have clean access to. The defiance in her face, maybe. The way she had continued the sutures while he spoke, as though his authority was simply not a variable in her calculation, and he had reacted to it in a way that he could not currently think about directly. He was thinking around it. The angles, the documentation, the witnesses, and what they would say. His phone buzzed. A text from his assistant, who was still downstairs. Marsh is in the building. He stood up. Then he sat back down. Then he stood up again because sitting felt worse than whatever was about to happen standing. He was halfway to the door when it opened. Evelyn Marsh came in first, Harlow behind her, and behind him, in a development that Yusuf had not expected and could not immediately process, was Nora Callahan. She was not in her scrubs. She was in her jacket and her street clothes, her backpack over one shoulder. Her left cheekbone had developed a bruise that was now visible from across the room, purple-edged, specific, the kind of mark that a camera could record cleanly. She stood in the doorway of his office with her hands loose at her sides and looked at him with an expression that was not angry. That was the part he wasn't prepared for. He'd prepared for anger. He'd prepared for tears, which he knew was a terrible thing to have prepared for, but which had been a variable in his modeling of the evening. He'd even prepared for the flat professional accusation of a person filing a formal complaint. He hadn't prepared for the particular quality of stillness in her face. The way she looked at him as though she was seeing the situation completely and had already decided what it meant. "Marcus," Marsh said, and her voice was not loud, which was its own warning. "Sit down." He sat. She remained standing. She did not take off the gray coat. "I have read Commander Harlow's summary of tonight's events," she said. "I have reviewed the incident reports filed in September and October. I have been briefed on the patient in Bay 2, and I understand that the nurse you fired 3 hours ago is currently in this building managing a trauma case because she walked back in after being escorted out." She paused. "I'd like to hear your account of this evening." He had the account ready. He started it. Protocol violation, documentation trail, pattern behavior. The sutures performed without authorization on an unregistered patient. "The patient was bleeding on the pavement," Marsh said. "The protocol exists." "Marcus," her voice was still not loud, "I am going to stop you there, because I have a number of serious things to address with you tonight, and I want to give them the weight they deserve rather than letting you spend the next 10 minutes building an argument on a foundation I am not going to accept." Silence. She reached into the leather folder she was carrying. She put a single page on his desk. "This is the complaint filed by Nurse Okafor, co-signed by Nurse Mercer, and 2 other staff members, received by HR at 9:43 this evening. I've read it." She put another page down. "This is the incident report from September, dismissed without review." Another page. October, same. She straightened. "And this?" she said, and she put down a photograph. Not a photograph, he realized, but a screen-captured image from a phone, time-stamped at 8:51 p.m., showing the ambulance bay clearly enough that everyone in it was identifiable, is what several staff members witnessed and at least one recorded tonight. Okitwa Arye Chorsheski. Yusuf looked at the image. He looked at himself in it. The specific angle of his arm. The specific moment. "That is an assault," Marsh said, "on hospital grounds, in front of staff, on a patient care worker who was actively treating an injured person." She clasped her hands in front of her. "I have also been told by Commander Harlow about the nature of Ms. Callahan's service record, which I will not pretend I fully understand, but which I understand well enough to know that the way this evening has unfolded presents a public relations situation for this hospital that is significant. More importantly," she paused, "it presents a moral situation, and I have always found the moral situation to be the more clarifying one." "Oh?" Yusuf started to speak. "No," Marsh said, "I'm not finished." He closed his mouth. From the doorway, Nora was watching. She had not moved. She had not spoken. She was simply present in the way that the mountain outside town was present, not imposing itself, just there, real, not going anywhere. "I came here tonight," Marsh said, "to understand what happened. I believe I understand it." She looked at Yusuf with an expression that was not unkind, but was irreversible. "I'm placing you on administrative leave effective tonight, pending a full board review. Security will escort you out of the building, and you will return your access credentials before you leave." Yusuf's face went through something complicated. "Evelyn, this is Marcus." She picked up the photograph. "You hit her, in your own parking lot, in front of your own people. There is no version of that I can work with." He went quiet. The room was quiet. Outside the window, the drizzle had stopped entirely. The parking lot was wet and still, and the helicopter's running lights made small red and white reflections on the standing water. Then Harlow's phone buzzed. He looked at it. His expression changed, not dramatically, but Nora caught it, because she had spent years reading the micro-expressions of people in command who were receiving information they hadn't expected. He looked at her. "Callahan," he said, "Walter Briggs is asking for you." She had started to move before the sentence was finished, but Harlow's hand came up, not stopping her, just slowing. "He's not in distress," he said. "He's asking because—" He looked at his phone again, then up at her. "He says there's something he needs to tell you, something he's been carrying since the Carmen briefing. He says he should have told you when you walked into his bay tonight, but he didn't know how to start, and now he wants to." She looked at him for a long moment. Harlow's expression was the specific, careful neutral of a person who knows what the thing is and believes it is significant, but has decided it belongs to someone else to say. She walked out of the office. She moved through the corridor and into the elevator and through the ER to Bay 4, and the closer she got, the more she understood that she didn't know what Walter Briggs could tell her that she hadn't already lived through, and also that the fact she couldn't predict it was the thing that was making her walk faster. She pushed through the curtain. Walter was sitting up. The coffee was gone. The half sandwich was gone. His hands were resting on the blanket, and he looked at her when she came in with eyes that had decided on something. "Sit down, Nora," he said. She sat. He took a breath, and then he said a name she had not heard spoken aloud by anyone outside her own memory in 3 years, a name that belonged to the operation and to the valley and to the 7 hours and to the one person who had not come home. He said Torres, and then he said, "I knew him, before Carmen. We served together in 2009. Nora's hands went very still on her knees. "He wrote to me," Walter said, 6 weeks before the operation. A letter. Actual paper, he always did that. Said email felt like talking to a wall. He told me about the corpsman his unit had been assigned. He said," Walter's voice was steady, but just barely, the steadiness of someone keeping a hand on something. He said, "Walter, this one's different. This one's the real thing. I'm teaching her everything I know because I want her to have it. And I need you to know that if something happens to me out there, the right person is going to have it." The monitor beeped. Nora was looking at Walter's hands on the blanket and not at his face. "He knew," Walter said. "I don't know how. Nobody knows how. But he wrote to me like a man who knew, and he told me about you by name, and he said to find you if you didn't come back." He stopped, steadied. "I never did. I told myself I didn't have enough to go on, that I'd misread the letter, that finding you would make it worse somehow." He looked at her directly now. He looked at her directly. "And then tonight I'm sitting on the pavement in the rain watching a blonde nurse close a leg wound in 5 sutures with hands like—" He stopped again. "Like his hands," he said. "Same economy, same angle." The bay was the smallest space Nora had ever sat in. "I should have found you 3 years ago," Walter said. "I'm sorry I didn't." She was looking at her own hands now. She turned them over, looking at the palms, the same hands that had held a piece of communications wire in a dark valley, while a man who had taught her everything she needed told her it was okay. She had it. She had everything she needed now. Her throat was doing something she was not going to let become more than that. "He was right," she said, "about the techniques." "I know. They worked. On everyone else. I know that too." She looked up at him. Her eyes were dry, but the space around them had changed in some way that had nothing to do with tears. "Why didn't you say this when I walked into your bay?" "Because you were treating my leg," he said, "and because I didn't know how to hand someone something like that while they were working." He looked at her with the direct, uncomplicated attention of someone who has stopped managing themselves for the benefit of an audience. "And because you looked like a woman who had been carrying something for a long time, and I wasn't sure if what I had would make it lighter or heavier." She was quiet. "Does it?" he asked. "Lighter or heavier?" She looked at the curtain, at the pale green wall, at the scuff mark near the light switch. She opened her mouth to answer him, and then the lights in Halverton General went out. Every single one, overhead, bay lights, corridor lighting, all of it, all at once, dropping the hospital into a darkness that lasted exactly 2 seconds before the emergency generator kicked in and the backup systems flooded everything with the flat, red-tinged emergency glow of a building in crisis mode. And in the same moment, from the ER proper, came the sound of voices, multiple, overlapping, the specific vocal quality of controlled panic, and then an overhead alert tone, and then a voice on the PA that said, with the forced calm of training over adrenaline, "Code Orange. All available personnel to the emergency department. Code Orange." Nora was on her feet before the PA finished. She looked at Walter. "Go," he said. She went. The Code Orange was a bus. Not a military thing, not a structural failure. A charter bus that had gone off the wet overpass 4 blocks north and come down on its side. And the count coming through dispatch was 19 passengers. Unknown injury severity. First units already on scene and calling it a mass casualty. The lights had cut because the surge demand from the generator test that maintenance ran every Tuesday at 11:15 had collided with a faulty transfer switch that someone had flagged in a work order 3 months ago and nobody had prioritized. And the 2-second blackout had been enough to spike the monitors in 3 bays simultaneously and send 2 nurses diving for manual backups before the emergency power restored. Nobody had time to think about any of that. The ER had already been moving when Nora came through the door, and it was moving with the organized urgency of a department that had trained for mass casualty and now had to execute it with whatever they had, which tonight was a reduced overnight staff, 2 residents, a surgical attending who was still 6 minutes from the building, and a trauma bay that was currently occupied by Derek Paulson, who remained the most critical patient in the building before the bus arrived and would continue to be for approximately the next 4 minutes. Donna was at the board clearing and reordering. Priya was on the phone with the charge nurse supervisor. Garza was in Bay 2 rechecking Derek's pressure, 81/54, holding but fragile, and trying to assess whether they could move him to make room before Vance got here. Tully saw Nora come in. "Callahan," he said it automatically, the way you call to the person who knows what to do. She was already reading the board. 19 incoming, estimated 8 to 12 minutes out. 4 critical per dispatch, 7 moderate, remainder walking wounded. She did the math on available bays, 3 functional, 2 compromised by the generator issue, 1 reserved for Derek, and looked at the treatment corridor. "Hallway triage," she said. "Walking wounded go there. You'll need 2 nurses and a cart each. Reserve the bays for the criticals and 1 moderate who you'll bump up to critical by the time they're inside." Tully looked at Donna. Donna said, "She's right. Let's move." Nobody asked who had authorized it. That was the thing about a code, Donna would think later. Authority simplified itself. The question was never who said so, but does this work? And the people who could answer that fastest were the ones the room organized around, regardless of their badge color, or their employment status, or the bruise on their left cheekbone. Priya came off the phone. "Backup staff is being called in. Earliest arrival 20 minutes. "We don't have 20 minutes, Nora said. She was pulling supply carts into position, rerouting traffic in the corridor with the spatial logic of someone who had organized treatment areas under conditions significantly worse than a hallway. "We work with what's here. Garza." He looked up from Bay 2. "When Vance arrives, how long to get Derek to OR?" She said 10 minutes prep once she's in the building. "Then we have a window." She looked at the bay. At Derek, who was pale and not fully conscious but breathing. At the monitors, which were stable in the specific unstable way of someone holding a position they couldn't hold indefinitely. "He stays where he is until Vance walks through the door. We don't move him without her eyes on him. That bay is his until she says otherwise." Garza nodded. "Agreed. The rest of us work around him." She turned back to the corridor. "Where's your crash cart backup?" Tully pointed. "Resuscitation supplies?" "Storage bay B, 3rd shelf." She went. She was back in 90 seconds with an armful of supplies she'd clearly located by memory of a layout she'd learned in 6 weeks, which should not have been enough time and yet obviously was. She distributed them with the efficiency of a person who didn't need to think about the mechanics of the task, because her hands already knew it. Gene, the orderly, appeared beside her. He was a man of about 45 who didn't talk much and worked hard and had watched the entire evening unfold with the careful attentiveness of someone building a complete picture. "What do you need?" he said. "Gurneys to the entrance, 4 of them. The criticals come in horizontal, and I don't want them waiting for transport." He went. Donna came and stood beside Nora for a half second, the specific half second of someone who needs to say something quickly. "You know you're still not technically—" "I know," Nora said. If anything goes wrong legally, I need you to know that I am documenting that I requested your assistance under mass casualty conditions as the senior nurse on shift." Nora looked at her. "Donna." "Yeah." "Thank you." Donna nodded once and went back to the board. The first ambulances arrived 8 minutes later. The criticals were what dispatch had called them. 2 with significant head trauma, 1 with a crush injury to the chest, 1 with a femoral fracture that had lacerated the vessel and was bleeding in the specific arterial way that made everything else secondary. The walking wounded were less walking than dispatch had estimated. Two of them needed to be reclassified on arrival, and one, a teenage girl with a cervical collar still on from the field, was quietly more injured than she appeared, and it was Nora who caught it, the subtle dysarthria, the pupils that were not quite symmetric, and rerouted her from the hallway corridor to Bay 3 with a note for Garza that said right-sided deficit, rule out intracranial bleed, CT head priority, and left it clipped to the rail because she was already moving to the femoral bleed. The femoral bleed was a 40-year-old man named, she got it from his wristband, Ruiz. He was conscious, which was remarkable given his pressure, and he was holding his own thigh with both hands in the specific way of someone who understood that releasing the pressure was going to accelerate something he didn't want accelerated. "I've got you," Nora said, beside him. "It's bad," Ruiz said. "It is, but you're doing exactly the right thing. I can feel it." "I know. Keep your hands exactly where they are. Don't let go until I tell you." She was already examining the field, assessing angle and depth through the compression. "You on any blood thinners?" "No." "Any medical history I need to know?" "Healthy," he said, and there was something almost wry in it, the specific irony of a healthy person lying on a gurney in an ER. "Good. That helps." She looked at Tully, who had materialized on the other side. "Tourniquet, high and tight. And I need a vascular surgery consult now. Is there anyone in the building?" "Vance does vascular," Tully said. "She's for Derek. She can triage. Let me call up." The tourniquet went on. Ruiz made a sound through his teeth. Not a scream, just a hard, compressed exhalation of pain that he was managing by sheer will. His hands came off when it was in place, reluctantly, and Nora immediately verified the compression was adequate and the distal pulse was what it needed to be. "You did good," she said to Ruiz. "Holding that, most people let go." "Seemed like a bad idea to let go," he said. "It was. Are you a doctor?" "Nurse." He looked at her with the clarity of someone whose brain was working harder than his body at the moment. "One hell of a nurse," he said. She didn't respond to that. She was watching the tourniquet site and thinking about Vance and Derek and the sequencing problem of two patients who both needed surgical intervention and a window that was compressing from both sides. Vance arrived at 11:41. She was a compact 50-something woman with short, dark hair and the no-frills efficiency of a surgeon who had been woken at home and driven 20 minutes through rain and was not going to waste time on anything that wasn't clinical. She came through the ER doors, already reading the situation from the hallway, the gurneys, the staff positioning, the particular energy of controlled high volume, and made it to Bay 2 in under a minute. She assessed Derek in 30 seconds, read Garza's notes, looked at the fast images. "OR2, she said. "Now, why didn't you move him earlier?" "He was borderline and we had a mass casualty coming in," Garza said. "Who made that call?" Garza pointed without particular self-consciousness toward the corridor where Nora was managing the femoral bleed. Vance looked. "She's not on staff," Garza said. "Long story. But her call was right." He held. Vance looked at Derek's current pressure, 82/56, and at the monitor trend, and then back at Nora, and did the kind of rapid unconscious assessment that surgeons did when they encountered clinical decisions that had been made by someone else. "Yeah," she said, "it was right. Let's move." Derek Paulson went to OR2 at 11:43. Vance stopped on her way out. "Who's the femoral?" "Bay 1, Callahan's managing him. I'll take him after Derek if he holds." She said the same thing. Vance looked at Nora again, from across the ER, for one more second, with the expression of a physician making a mental note she intended to return to. Then she went. By 12:30, the ER had absorbed the bus. Not cleanly. There was nothing clean about a mass casualty, even when it went as well as this one had, but functionally. The criticals were distributed, the moderates were being managed, the walking wounded were treated and documented in the corridor. The teenage girl with the cervical collar had gone to CT, which had confirmed a small subdural hematoma, which was significant but caught early enough that neurosurgery was now involved, and the prognosis was cautiously reasonable. Ruiz was stable with his tourniquet in place, and Vance had already said she'd go to him next. The backup nursing staff that had been called in were arriving. 2 of them, then a third, and the ER was becoming less reliant on improvisation and more capable of its regular structure, which meant that Nora, who had spent the last 90 minutes functioning as the load-bearing element of a department that had been understaffed for a mass casualty event, was now in the specific position of someone who was no longer structurally necessary. She was standing at the corridor's edge, pulling off a pair of gloves, when Donna found her. "You okay?" Donna said. "Yes." "You sure? Because you've been—" "I'm fine, Donna." Donna looked at her. She knew Nora wasn't entirely fine. No one who'd had the night she'd had was fine. But she also knew that asking again wouldn't get her further than that. And there was a particular kind of person who answered questions about their own state with the flattest version of accurate and then got back to work, and Nora was clearly that kind. "Marsh wants you," Donna said. "When you're done here." Nora looked up. "Where is she?" "Conference room B, second floor. She's been there since the code went out." She said. Donna paused. "She said to tell you there's no rush, that this was more important." Something moved through Nora's expression. Small, unidentifiable. "She watched the code?" "From the doorway, for a while." Donna folded her arms. "She saw you with Ruiz. She saw the cervical collar kid. She saw all of it." Nora said nothing. "Also," Donna said, and her voice changed slightly, lowered a register. "Yusuf is still in the building." That was unexpected. "Marsh told him to go." "She did. He said he needed time to gather personal items from his office. That was an hour ago." Donna's mouth pressed together. "Security went up twice. He keeps saying 5 more minutes. Admin thinks he's on the phone with his lawyer." Nora absorbed this. It didn't read as threatening, more like the rearguard action of a man stalling because leaving meant accepting what the leaving meant. She'd seen that before. Men who'd been removed from things they'd built their identity around often couldn't make themselves complete the physical act of departure. "Let him finish his calls," she said. "He's not going anywhere that matters." Donna looked at her. "You're not angry at him?" It wasn't quite a question. "I'm not angry," Nora said. She looked at the gloves in her hand. "But I'm tired. And there's a difference between being angry and needing to watch someone leave." She dropped the gloves in the biohazard container. "Marsh will handle it. That's her job." Conference room B was small and smelled like old coffee and carpet cleaner and the particular staleness of a room that got used for difficult conversations. Marsh was at the table with a legal pad in front of her that had handwriting on it. Notes she'd made during the code, Nora realized, sitting in this room and documenting what she'd seen. Harlow was there too, and Henderson, in the corner with his tablet, and Walter Briggs, in a wheelchair that someone had brought up for him, his bandaged leg extended, his old phone on the table in front of him like a prop in a play he'd agreed to appear in. Nora sat down. Nobody spoke immediately. It was the quiet of a room that had been actively occupied and was catching its breath. Marsh spoke first. "How are the patients from the bus?" "Stable, mostly. The subdural is the most concerning. She's young, but it was caught early. Ruiz goes to OR when Vance is done with Derek Paulson." Nora paused. "Derek should be fine. The hepatic lac was manageable once they got in there. Vance is good." "I know she is," Marsh said. "I hired her." She wrote something on the legal pad. Then she set the pen down and looked at Nora directly. "I want to tell you what I saw tonight. Not administratively, just what I saw." Nora waited. "I watched you walk back into this building twice after being fired and escorted out," Marsh said. "I watched you catch a pneumothorax in the wrong side through a curtain. I watched you triage 19 patients with no authority, no employment contract, and a bruise on your face that my CEO put there." She was quiet for a moment. "I watched a teenager go to CT because you looked at her pupils from across a corridor." She picked up the pen again, held it. "I have been running board oversight for this hospital for 7 years, and I have never watched anything like what I watched tonight." Nora said nothing. "I also spoke with Commander Harlow at length about your service record," Marsh continued, "the parts he's permitted to discuss, the Carmen operation context, the inquiry." She said that last word carefully, with a specific weight, the inquiry that was closed and should have been expunged. "It was a long time ago," Nora said. "It was an injustice," Marsh said. And it was done to you by a man who prioritized his own liability over your record and then told you the record was clean when it wasn't. That's... She stopped. I don't have authority over what happens with that document. Commander Harlow does. But I want you to know that I know it happened. Harlow said from across the table, I've already submitted the supplemental and the contextualization request. The inquiry language will be flagged as administrative record keeping rather than clinical assessment. It won't disappear from the file. It can't, but it will be accompanied by a full after-action counter-narrative that corrects the record. He looked at her steadily. He looked, and Reyes's conduct in telling you it was expunged when it wasn't has been referred to the Office of the Inspector General. Nora looked at the table, at the grain of the wood, which was laminate over particle board, the cheap kind, the kind conference rooms and working hospitals had because the budget went to equipment, not furniture. I'm not looking for anything from that, she said. I know, Harlow said. But it's being handled regardless, because it was wrong and because the record needs to be accurate. Walter, from his wheelchair, said, Let it be handled, Nora. She looked at him. He looked back at her with the patient, unmoving attention of a man who had learned that sometimes the right response to being told something is done for you is to let it be done. She nodded. It was Marsh who brought the room to the next thing, and she did it by reaching into the folder she'd been carrying all night and placing a single document on the table. I want to discuss your position here, she said, or more specifically, the position I'm going to offer you. I was fired tonight, Nora said. You were fired by a man who is currently in his office avoiding security and who will not be employed by this hospital by morning. Marsh didn't soften it or elaborate on it, just stated it as weather. The termination is nullified. Formally, as of right now, this evening's termination notice does not exist. She tapped the document. What I'd like to talk about is what comes next. Nora looked at the document but didn't reach for it. The 2 incident reports you filed, Marsh said, the sepsis patient in October, the intake delay issues you flagged in September. Both of those identified real problems. The sepsis patient nearly died because the protocol you identified as inadequate was inadequate. She paused. I didn't know about either report until tonight. That's a failure in our oversight structure, and it's one I intend to correct. The reports went to Yusuf, Nora said. They went to Yusuf and they stopped there, which means this hospital has a reporting structure that filtered real clinical concerns through a single administrator who had personal incentives to dismiss them. Marsh was not defensive about this. She stated it the way she'd stated everything else, directly, without performance. That structure is changing, immediately. Nora looked at her. What do you want from me, Ms. Marsh? I want to know if you'll stay, Marsh said. Not in the same role. Not as a floor nurse under a hierarchy that clearly underutilized what you bring. She slid the document closer. I want you to lead a clinical protocols review. Work with our department heads, ER, trauma, surgical, to identify where our intake and triage policies are creating gaps in patient care. The same kind of gaps you flagged in those reports. The kind that could kill someone. The room was quiet. That's not a nursing job, Nora said. No, Marsh said. It's not. It's something more than that. I'm aware I'm improvising the title as I go. A beat. But I watched you run triage for 19 patients tonight in a department that would have been overwhelmed without you, and I watched you make every decision correctly and hand authority back to the physician the moment the physician was capable of holding it, and I think you understand both what's broken here and how to fix it without breaking the people trying to do the work. Nora sat with that. Harlow was watching her. Walter was watching her. Donna, who had appeared in the doorway at some point without being invited and had not been asked to leave, was watching her. The intake protocol, Nora said finally. The registration before contact rule. That's the first thing. Gone, Marsh said. Not just modified. Gone. Clinical contact cannot be secondary to administrative process for anyone presenting with visible injury or distress. Agreed. And the incident report chain needs an independent pathway, something that doesn't route through the CEO's office. I'm building that this week, Marsh said. Nora looked at the document again. This time she picked it up. She read it. Not skimming, actually reading the way she read everything, completely, before forming an opinion. It took about 90 seconds. The room let her have the 90 seconds. She put it down. I'll need to see the full protocols package before I commit to a redesign timeline, she said. Of course. And I want it in writing that clinical staff can override administrative directive in active patient care situations without fear of termination. That's going to require board approval for the formal policy, Marsh said. But I will personally guarantee its implementation in writing tonight. Okay, Nora said. It was a small word for something large. Marsh seemed to understand that. She didn't celebrate it or expand on it, just nodded once, the acknowledgement of a business person who knows when a deal is made. Yusuf left the building at 1:14 a.m. He came down the back stairwell rather than the elevator, which meant he went past the supply corridor rather than through the main lobby, and it would have been an unremarkable exit, except that the supply corridor was where Donna and Priya and Jean, the orderly, were taking a break at that exact moment, leaning against the wall with coffees they'd finally had time to make. They saw him. He saw them. He had a box under his arm, the kind people carried when they cleaned out offices, cardboard, the standard vessel of corporate endings. His tie was off. His lanyard was gone, credentials surrendered as Marsh had requested. He looked like a man trying to accomplish something quickly and quietly, and finding that even the back stairwell of a hospital had witnesses. Nobody said anything for a moment. Then Jean, quiet. Jean, the orderly who had handed Nora the biohazard bag in the parking lot, who had brought gurneys to the entrance at 11 p.m., who had been doing the work of this hospital for 9 years without anyone asking his last name, looked at Yusuf and said, without anger, without satisfaction, just with the flat accuracy of a man stating what he saw, "You fired the wrong person." Yusuf kept walking. He went through the exit, and the door closed behind him, and the three of them stood in the supply corridor with their coffees, and Priya said, "Jean," and Jean said, "Yeah." And that was the end of that. 18. At 2 a.m., Walter Briggs was back in Bay 4. He had been returned to the bed after the conference room, his leg re-elevated. A fresh cup of the bad coffee on his tray because it turned out bad coffee was the one thing this hospital had in reliable supply. Harlow had gone to make calls. Henderson was in the lobby. The ER had settled into the post-surge quiet of a department that had given everything it had and was now running on fumes and professionalism. Nora came in and sat in the chair beside his bed. They didn't talk for a while. "You signed something," Walter said eventually. "Marsh made me an offer." "Good one?" "Yeah." She looked at the bandage on his leg. "How's the pain?" 4 out of 10, he said. "I've had worse." "The sutures should hold. You'll want to see your own doctor in 5 days to have them checked." "I know," he said. "You told me that in the parking lot." She almost smiled. Not quite, but almost. "Torres wrote to me 6 weeks before Carmen," Walter said again, not repeating it for her benefit, for his own, the way people returned to things they needed to say until the saying of them felt complete. "He said you were the real thing." He was right. "He was better than me," she said, "at the medicine, the instinct. I learned from watching him as much as from what he taught directly." "He'd be glad to know that," Walter said. She looked at her hands, then at the wall. "I used to think," she said, "that leaving the service was moving away from something, from what happened, from the valley and the inquiry and all of it." She paused. I think I was moving toward this, whatever this is, a hospital where the intake policy was killing people by inches." She said it without drama, just assessment. "The incident reports were, I filed them because the problems were there and the problems needed to be on record. Not because I thought anything would happen, but and now something happened," Walter said. "Because you needed a leg stitched." "Because you stitched it," he said. "There's a difference." She looked at him. He was right, and she knew he was right. And that was the specific uncomfortable thing about being seen accurately by someone you'd only known for 5 hours, but who had apparently been carrying your name in a letter for 3 years. She was about to say something, she wasn't sure what, just that something needed to be said, when Harlow appeared in the bay entrance. His expression had the quality of something new. "Callahan," he said. She looked at him. "I need you to come with me." "What happened?" "Press," he said. 3 news vans just pulled into the parking lot. Someone on the evening staff leaked the story, the helicopter, the firing, the assault, the mass casualty, the whole thing. He said it without inflection, just data. Marsh is aware. She's deciding how to respond. But there's something else. She waited. Yusuf gave a statement, Harlow said, to one of the reporters in the parking lot about 20 minutes ago, on his way out. He paused. He said that the nurse's termination was legitimate and that tonight's events were being characterized incorrectly. He said the military's involvement was... He paused again, choosing his word. He called it theatrical. The bay was very quiet. He gave a public statement, Nora said. On camera, Harlow said, with his name, Walter Briggs, from his bed, with his coffee cup and his bandaged leg, and the particular stillness of a man who had been waiting for the right moment, said, Well? He reached for his phone. He dialed the number he'd had memorized for years. It rang once. It's Briggs, he said. I need you to send me everything we're cleared to release about the Carmon operation. He paused, listening. Not the classified elements. The parts that are on public record. The after-action summary that was declassified in 2022. Another pause. Yes, tonight. Right now. He looked at Nora. And I want the commendation records. All of them. He ended the call. He looked at Harlow. Get the board chair, he said. Get her people in front of those cameras before Yusuf's statement is the only thing on the morning news. Harlow was already moving. Nora stood in Bay 4 and understood, with the particular clarity of someone watching pieces arrive at their positions, that the night was not winding down. It was becoming something else entirely. And the thing it was becoming had Yusuf's name on it, and cameras, and a classified commendation that was about to be not so classified, and an old veteran with a phone who had spent 3 years carrying a letter and tonight had decided he was done being the only one who knew what it said. The 3 news vans had parked badly, the way press vans always did when they arrived fast. 2 of them half on the curb, the third blocking a section of the ambulance lane that would have mattered if they'd arrived an hour earlier during the bus incident and didn't matter now. Their lights were up and running, the portable kind that turned wet pavement into something that looked like a film set. And a reporter Nora didn't recognize was already doing a stand-up near the entrance with the helicopter visible behind her, its tail rotor catching the light in a way that was probably exactly what the producer had asked for. Harlow had reached Marsh before Nora made it out of the bay, and Marsh had been ready in the way that board chairs who'd spent 7 years managing institutional crises were ready. Not calm, exactly, but functional within the disruption, her legal pad already turned to a fresh page. The lobby outside the ER had become a staging area. Harlow on one side with Henderson and his tablet. Marsh with the hospital's communications director, a young man named Philip, who had been called in from home and arrived with his shirt buttoned wrong and was now working his phone with the intensity of someone making up for a 30-minute gap. Donna and Priya at the corridor edge, not sent away, not formally included, just present, the way staff always stayed proximate to the thing that was going to determine what happened to their workplace. Nora stood near the window looking at the vans. Harlow came up beside her. Marsh wants to address it directly. Not a written statement, live, in front of the cameras. She says if Yusuf's statement is on record, the hospital's response needs to be on record in the same format. That's the right call, Nora said. She wants you there. Nora looked at him. Not speaking, he said. Present. She says the story is yours whether you talk or not, and standing next to her when she speaks is a choice you can make. Or not make. Or not make, he agreed. She looked back at the vans, at the reporter doing her stand-up, probably sketching the outline of what she knew, which was the helicopter and the firing and the mass casualty and whatever Yusuf had given her in the parking lot. The shape of a story that was true but incomplete. What did Walter send? She asked. Harlow's phone was already in his hand. Declassified after-action summary from Carmen. Public record since 2022. The commendation records, 2 of them, both from Naval Special Warfare Command. And a personal statement from Chief Briggs that he drafted in the last 15 minutes on his phone in Bay 4. She looked at him. He drafted a statement from his hospital bed. He types fast for a man on a painkiller drip, Harlow said. She almost laughed. It didn't quite make it all the way out, but it got close enough to change her face for a second. Okay, she said. I'll stand with Marsh. They went out at 2:22 a.m. Marsh led. Nora beside her, one step back. Not hiding, not performing, just occupying the correct position. Harlow to Marsh's left. Henderson had printed the relevant documents on the hospital's lobby printer in the preceding 10 minutes, and they were in a folder under Marsh's arm. The reporters converged. Marsh raised one hand, not dramatically, just the gesture of a person who has run enough meetings to know how to indicate that she'll begin when she's ready and not before. My name is Evelyn Marsh. I am the chair of the board of directors of Halverton General Medical Center. I want to address the events of this evening directly and on the record. She didn't read from notes. She'd put the folder under her arm, and she spoke from what she knew, which turned out to be quite a lot, stated with the precision of someone who had spent the last 2 hours getting very clear on the facts. She described the firing. She described the assault. She described the mass casualty response. She did not editorialize. She stated what happened in the sequence it happened, and the sequence was its own argument. Then she said, I also want to address the statement made earlier tonight by the former CEO, Marcus Yusuf, in which he characterized the military's involvement in this situation as theatrical. The reporters were very still. Commander James Harlow of the United States Navy is here tonight because a decorated combat veteran, Chief Petty Officer Walter Briggs, USN, retired, was treated by our nurse in the ambulance bay after sustaining an injury. Chief Briggs made a call. Commander Harlow responded. She paused. The nurse Marcus Yusuf fired tonight for treating that veteran on the pavement is a former Navy corpsman who served in a classified special operations capacity. Her service record includes multiple commendations from Naval Special Warfare Command. She maintained the lives of critically wounded service members under combat conditions for a sustained period that I am not at liberty to describe in full, but portions of which are available in declassified form and will be provided to press. Philip stepped forward and distributed the printed pages. Nora watched the reporters read, watched the moment when the shape of the story changed for them in real time, their eyes moving faster, one of them looking up at Nora with an expression that was recalibrating. Marcus Yusuf, Marsh said, has been placed on administrative leave pending a full board review. I want to be clear about the grounds, not solely because of tonight's events, because we have identified a pattern in which legitimate clinical concerns raised by nursing staff were filtered through his office and dismissed without review. A patient came close to dying from a sepsis presentation that was correctly flagged by this nurse 6 weeks ago and ignored. Another patient, she paused, another patient bled in our parking lot, while our intake system, designed by Marcus Yusuf and enforced by Marcus Yusuf, required registration before clinical contact. The nurse who is standing beside me tonight violated that policy because a human being was bleeding. She was fired for it. And then she walked back into this building twice to continue caring for our patients. The reporter closest to them, a woman in her 40s with the steady eyes of someone who'd covered enough to not be surprised by much, looked at Nora and said, "Can I ask your name?" "Nora Callahan," Nora said. Her voice came out steady. "Miss Callahan, do you want to say anything?" She hadn't planned to. She'd agreed to stand here, not to speak, and she was aware of the difference. But the reporter was looking at her with the direct, uncomplicated attention of someone who wanted the actual answer to an actual question, and Nora had never been good at deflecting things that deserved a straight response. "I want patients who come to this hospital to know they will be treated," she said. "Whatever paperwork is pending, whatever their insurance situation is, if they're bleeding, someone will stop the bleeding first." She paused. "That should never have been something worth fighting about. I hope it isn't going forward." The reporter wrote something down. That was all, Nora said. By 4 a.m., the statement had been picked up by 2 regional affiliates and 1 national wire service. By 6 a.m., Yusuf's own statement, theatrical, had been clipped and placed next to Marsh's description of his conduct, and the contrast was doing what contrasts did when they were stark enough and the facts were clear enough. By 7 a.m., 3 things had happened in the order in which they became inevitable. The first was that the Oregon Health Authority's licensing division received a formal complaint referral from Halverton General's Board, documenting the intake protocol issues, the dismissed incident reports, and the pattern of administrative suppression of clinical concerns. The complaint specifically named Marcus Yusuf and the conduct in the ambulance bay and attached the photographic documentation that had been time-stamped at 8:51 the previous evening. The second was that Yusuf's attorney released a statement through a PR firm which used the words context and mischaracterized and administrative discretion in ways that, when placed next to Marsh's specifics, read like a man explaining that he had reasons for things he had done rather than disputing the things themselves. The third was that Derek Paulson came out of surgery. Vance had controlled the hepatic laceration, the pressure had stabilized on the table, and the resident who delivered the update to the ER at 6:48 a.m. said simply, "He's out. He's good." Garza, who had been awake for the entirety of it, put his hands on the nurse's station counter and pressed his forehead against them for about 5 seconds. Nobody commented on this. It was the kind of thing you got to do at the end of a night like that. Nora heard the update from Donna, who found her in the family waiting room where she'd sat down sometime around 3 and had, without intending to, fallen asleep in a chair with her jacket over her shoulders. She woke to Donna's hand on her arm, and the news that Derek was out, and that Ruiz was also post-op and recovering, and that the teenage girl from the bus, her name was Cassidy, had been admitted to neurology and was talking and responsive and asking for her parents. She sat with all of that for a moment. "You should go home," Donna said. "I know. Actually go this time, not 3 blocks and then back." Nora looked at her. "How's Walter?" "He slept. He's having breakfast. He wants to see you before you leave." Bay 4 smelled like hospital eggs and the bad coffee that was apparently this building's most consistent offering. Walter was eating with the careful attention of a man who had been told his blood sugar needed monitoring and was taking it seriously. He looked up when she came in. "You slept," he said, "in a waiting room chair. Still counts." He pointed at the chair beside the bed. "Sit." She sat. He finished a bite of egg, put the fork down, looked at her with the direct attention she'd gotten used to in the past several hours. "How do you feel?" She thought about the honest answer to that question, which was complex enough that giving it accurately would take longer than either of them probably had available. "Like something shifted," she said. "I don't have a cleaner word for it." "Something did shift," he said. Yeah." He was quiet for a moment, then, Torres would have liked this. The whole mess of it. He smiled, barely. Not the smile of someone performing sentiment, but of someone genuinely accessing a memory. He liked when things that were supposed to be simple turned out to be the opposite, said it meant the situation was honest. "That sounds like him," she said, and then stopped, surprised, because she hadn't said anything like that, hadn't referenced anything like that. In 3 years. The words had just come out, and they were right. "He used to say," Walter continued, "that the best medics he'd worked with weren't the ones who knew the most. They were the ones who couldn't leave a patient alone. Like it was personal. Like every single one was personal." He looked at her steadily. "Is it? For you?" She thought about Derek Paulson's pressure trending down in her hands on the IV line. About Ruiz holding his own thigh on the pavement of a highway after a bus accident. About Cassidy's uneven pupils in a corridor. About a man she'd known for 45 minutes bleeding on the pavement of a hospital parking lot in the rain. "Yes," she said. "Good," he said. "That's the thing. That's the whole thing. Don't let anyone administer it out of you." She looked at her hands. "They tried tonight," she said. "They tried," he agreed. "Didn't work. Chum." Harlow found her in the lobby at 8:15. He was carrying 2 cups of coffee from somewhere that wasn't the hospital, which meant he or Henderson had made a run, which was more human than she'd expected from a Navy commander at the end of a night like this. He gave her one. She took it. They stood near the window. The helicopter was still in the parking lot. It would leave sometime today, she supposed, after whatever documentation Harlow needed to complete. The morning was coming in gray and specific, the kind of Pacific Northwest morning that wasn't dramatic, just present, the light arriving without making a production of itself. "My CO wants a full briefing," he said. "The Carmen context, the inquiry, the Reyes situation, all of it." He drank his coffee. "I told him the person at the center of it was still here and asked if he wanted to wait. He said yes." "He doesn't need to talk to me," Nora said. "It's in the file." "It's in the file," Harlow agreed. "He still wants to wait." She understood what that meant, and she didn't argue with it. "The supplemental," she said. "The Reyes referral. How long does that process take?" "The OIG referral? Months, maybe longer." He paused. "But the file correction happens faster. The inquiry language will be contextualized within the week. Torres's contribution, the technique attribution, will be in the record by end of day. She nodded. It's not nothing, he said. I know it doesn't change what you carried, but it's not nothing. No, she said, it's not nothing. They drank their coffee. Outside, a car pulled into the lot, and a woman got out with a child on her hip and a look of weary purpose that meant she was someone's family member coming for visiting hours. And the entire ordinary weight of what a hospital was. Not a crisis, not a mass casualty, not a night like last night, but this, a woman with a child coming to see someone she loved, settled over the lobby for a moment. You're going to stay, Harlow said. It wasn't really a question. I signed something. That's not why. She looked at the woman in the parking lot who was now struggling with the door because her hands were full. A security guard she didn't recognize from last night went and held it for her. No, she said, it's not why. At 10 a.m., Evelyn Marsh convened an emergency all-staff meeting in the hospital's largest conference room. It was not a large room. Halverton General was not a large hospital, and there were people standing against the walls and sitting on the floor near the front, the overnight staff who hadn't gone home yet mixed with the morning shift who'd arrived to the aftermath, and a general collective state that was somewhere between exhaustion and the specific alertness of people who understood they were at an inflection point. Marsh stood at the front without a podium. She had finally taken off the gray coat. She spoke for 12 minutes. She covered the night's events without drama, the same way she'd spoken to the press, and then she covered what was changing, the intake protocol, the incident report structure, the new clinical protocols review process, and the person who would be leading it. When she said Nora's name, nobody cheered. It wasn't that kind of room or that kind of moment. But something moved through the assembled staff, a settling, a recognition, the collective exhale of people who had been told something true. Nora was standing near the back. Donna was beside her. Priya on the other side. Jean, the orderly, was near the door, still in his scrubs from the night before, and he caught Nora's eye briefly and nodded once. The minimal acknowledgement of a man who'd said what needed saying in a supply corridor at 1 a.m. and considered the matter handled. Tobias Webb, the second-year resident who had spent the first part of the evening examining Nora's suture work with barely concealed disbelief, was near the middle of the room. When the meeting ended and people began to move, he found her in the crowd. Hey, he said. Hey, I looked up the Carmen After Action summary this morning. He said it directly, the way residents talked when they were being honest rather than careful. The chess technique you used during the operation, the one attributed to Torres. He paused. I've been doing a version of that wrong for 2 years. The angle is different than how I was taught. She looked at him. Which part? The entry point. I was going into anterior. By how much? Maybe 2 centimeters. That's a meaningful 2 centimeters, she said. I know that now. He looked at her steadily. Can you show me the correct approach? Yes, she said. Come find me this week. He nodded. He started to go. Then he stopped and turned back and said, with the specific discomfort of a person delivering something they feel they owe but aren't practiced at delivering. I also want to say last night when you caught the wrong side needle in Bay 2, I was defensive about it. You were quick, she said, once you knew. He stopped. I want to be better than that. The defensiveness. Most people with good instincts are defensive before they're confident, she said. You'll get there. He left without trying to make it into more than it was, which was the right call and one she respected. Walter Briggs was discharged at 11:30. The paperwork took longer than the clinical component, which was true of most hospital discharges and which Nora would be adding to the protocol's review list by end of week. He was being picked up by his daughter, a compact woman in her late 40s who had arrived at 9 a.m. and had clearly been conducting her own assessment of the situation from the family waiting room, and who looked at Nora when they were introduced with an expression that said she had already been told the story and had formed opinions about it. My father says you talk to him like a person, she said. He is a person, Nora said. A lot of medical people forget that, his daughter said. Not accusatory, just a fact she was accustomed to living with. Walter was in the wheelchair waiting for transport to the entrance. He had his old phone in his pocket and his walker folded and ready. He looked like a man who had finished what he came to do. Nora crouched beside the wheelchair so they were at eye level. I'm going to check the sutures through your own doctor, she said. But if anything looks wrong before that, any redness spreading, any fever, any increase in drainage, Nora, you call the ER, not a nurse line. Direct to the ER. Nora, he said again. She stopped. He looked at her with the steady, undecorated attention she'd gotten used to. I know, he said. I've been living in a body for 74 years. I know when to call. Right, she said. Sorry. Don't apologize. He looked at her. You're going to be good at this. The protocols work. That too. He paused. But I meant the other thing. The staying. He looked toward the hospital corridor, the board on the wall, the morning staff moving past with the quiet purpose of a building that had been through something and was still standing. Some people move toward the hard thing their whole career and never land anywhere. You landed. She didn't have a response to that. He seemed to understand she didn't need to have one. His daughter wheeled him toward the entrance. At the door, he looked back once. She raised her hand, not a wave, just an acknowledgement. He did the same. Then he was gone. The last thing that happened was not in the hospital. At 2 p.m., a statement was released by the Oregon Health Authority confirming receipt of the formal complaint against Marcus Yusuf and the initiation of a licensing review process. At 3 p.m., Yusuf's attorney released a second statement, this one shorter and less confident than the first, confirming that his client was cooperating with the review and would have no further public comment. At 4 p.m., Nora was sitting in the empty conference room B with the full protocols package Marsh had sent to her desk. 3 inches of paper, sections tabbed in 4 colors, every intake policy and treatment guideline and administrative directive that governed what happened to patients in this building from the moment they arrived to the moment they left. She'd read 40 pages of it and had already flagged 11 things. Her coffee was cold. She hadn't noticed when it went cold. Donna knocked on the door. You're still here, Donna said. There's a lot to read. There will still be a lot to read tomorrow. Nora looked at the stack. The intake protocol is more broken than I thought. It's not just the registration before contact rule. The triage sequencing in the first 10 minutes has 4 separate administrative checkpoints that don't have clinical override options built in. Nora. People could die in those checkpoints. Nora. Donna sat down across from her. Go home. Sleep. The protocols will be broken tomorrow in exactly the same ways they're broken today, and you'll read better after 6 hours than after 22. Nora looked at her, at the honest, tired face of a woman who had worked the same long night she had, and was still here, still present, still paying attention. You're right, Nora said. I know. Donna folded her hands on the table. For what it's worth, what you did last night, the way you handled it, not just the medicine, but the whole thing. Giving authority back to Garza when you could have just run everything yourself. The way you talked to Ruiz while you were tourniqueting his leg. She paused. You have a way of making people feel like they're not alone in the worst moment. That's not something you can teach. Nora looked at her stack of papers. Torres taught it to me. Maybe, Donna said, but you had to already be someone who could learn it. Nora was quiet for a moment. I didn't save everyone, she said. Last night, Carmen, any of it. It's never a clean thing. There's always a cost. Yes, Donna said. She didn't try to soften it. There is. I need people to understand that about this job, Nora said. When I'm doing the protocols work, I need the policies to account for the fact that even when everyone does everything right, sometimes the outcome isn't right. And the answer to that isn't more checkpoints. It's faster access, more support, fewer barriers between the patient and the person who can help them. Then put that in the report, Donna said, in exactly those words. Nora looked at her. Donna shrugged. I read your incident reports. You write clearly. Nora closed the protocols binder. She put it in her bag. She picked up the cold coffee and stood. Same shift tomorrow? She asked. I'm on day shift, Donna said. I don't actually know what your hours are now. Neither do I, Nora said. I'll figure it out in the morning. She walked out of this conference room and through the corridor and past the nurse's station where the evening shift was coming in. The handover notes being exchanged, the board being updated with the day's cases and the current census and all the living, ongoing machinery of a hospital that had been through something and was continuing anyway. She nodded to Priya on her way past. Priya nodded back. At the main entrance, she stopped. Not for long, just a moment. She looked at the lobby, the donor plaques on the wall, the scuff marks on the floor, the information desk with the half-dead plant behind it that someone had clearly been meaning to water and kept forgetting. She looked at the emergency department entrance around the corner where 14 hours ago she'd been walking out with her backpack and a bruise and a firing that was supposed to be the end of something. The thing about endings, she thought, was that they were almost never what they looked like at the time. What looked like an ending from the inside of it often turned out to be a pivot. The moment before the thing you were supposed to be doing became clear enough to move toward. She hadn't come to Halverton to be recognized. She hadn't come to be vindicated or celebrated or found. She'd come because they were hiring and because it was quiet and because she thought maybe quiet was what she needed after everything. She'd been wrong about the quiet. But maybe the wrong thing had led to the right thing, the way misdirection sometimes did. Not smoothly, not cleanly, with a slap in a parking lot and a helicopter and an old man's letter and a night that tried everything it had to break the shape of what she was. It hadn't. She pushed through the door. The afternoon air was cold and clear. The rain finally gone. The sky over Caldwell the particular washed blue that came after Oregon rain. Specific, almost mineral, like the color of something scrubbed clean. The helicopter was still in the parking lot, and there was a small crew around it now, Harlow's people doing whatever they needed to do to make it ready to leave. Harlow saw her from across the lot. He raised his hand. She raised hers. He walked over, and when he was close enough, he reached into his jacket and took out a card. Not government-issued, just a plain card with a number written on it in pen, the low-tech kind of contact information that meant it was personal rather than official. "If anything comes up with the file," he said, "or with the Reyes situation, or anything else." She took it. "Thank you, Commander." "James," he said. She looked at him. "We've been through enough of a night," he said. "James is fine." She put the card in her jacket pocket. "Thank you, James." He nodded. He went back to the helicopter. She stood in the parking lot of Halverton General and let the October afternoon be what it was, cold and clear and unheroic, the ordinary texture of a day that came after something extraordinary, and asked nothing of her but to be present in it. She thought about Torres. She thought about what he'd said to her once, in a quiet hour between rotations, when she'd asked him why he kept teaching her things. He'd looked at her with that slight, specific smile of his and said, "Because knowledge doesn't die when I do if someone else has it. That's the whole point of passing it on." She had passed it on. To Garza, in a small way, in one night. She would pass it on again, in the protocols, in the training, in every policy change that meant someone arrived in the bay with a leg wound and was treated before the paperwork and not after. That was not a legacy. It was not a monument. It was something quieter and more durable than either. The ongoing, ordinary, essential work of making sure the people who came through the door were met by someone who could help them, who would help them, without hesitation and without condition. She had walked out of this parking lot last night like it was an ending. She walked back toward the street now and understood it had never been that. Some people spent their whole lives running from what they were. It was exhausting work and it failed eventually, because what you are finds you in the rain in a parking lot with a stranger's blood on your hands, and the answer comes out of you before you've decided to give it. She was someone who ran toward the bleeding. She had always been that person. She would always be that person. That was enough. That had always been enough. She turned up the collar of her jacket against the October air and walked, and the helicopter lifted behind her with the deep percussion of something departing, and the sky over Caldwell was blue and cold and open, and Nora Callahan went home.